Thank you. Hello, everyone. I guess I'm live. Good morning, everyone. Can someone reply in the chat if I'm clearly visible, audible, everything is good to go? Can you people respond? Anyone in the chat box? Good morning, Karthik. Good morning, everyone. Let me open this also, the Telegram. Yes. So, Megha, doxycycline, am I clearly visible, audible? Everything is good to go. You have to confirm. Can we start the session? Yes, please. Okay, all good to go. Very good, very good. So I welcome you all for today's session. Very, very good morning to all of you. A new day with new energy, with new enthusiasm. We will start the topics today. So we have already started community medicine yesterday. It's a 4-day series, right? So yesterday we have completed 3 major chapters. Today also I am going to cover 3 major chapters. After that, all small chapters we will cover in bulk. I know. But whenever the major chunk is covered now in PSM, so the biggest chapter in entire community medicine is epidemiology that we are going to start right now. So I guess you already received the notes of that. Hannah, you can open it, right? So let me start with epidemiology. Can I start with epidemiology? Students are still joining. We will wait for few more seconds. Okay, 10-15 seconds more. Okay, and we will start immediately with the epidemiology. So I'm going to continue epidemiology, finish it as soon as possible. After that, the second major chapter which we are going to take today is preventive obstetrics and pediatrics, and the third is the demography. So after that, we are having very small chapters. Hana. So tomorrow we will take the waste management and disaster management, hospital acquired infection, and small chapters are there that we will finish in half hour. And international health, history and medicine. So all these small chapters, 7-8 chapters that we are going to cover tomorrow. And the last day, communicable, non-communicable disease. Tomorrow we will cover biostats also. So in this way, ultimately we are going to cover all the 16 chapters. What you are asking, Aditi? Which content? Fish content means? Did you find out about fish content? Oh, I guess this thing. You are asking about the iodine, no? So in the aquatic plants, iodine is abundant, but not in fish. Okay, can we go ahead? Okay, so can we go ahead now? So let's start with epidemiology. Without wasting any further time, let's start with epidemiology. Okay, in the epidemiology, let's start. What is epidemiology? Epidemiology. Logy means study. है ना? Epidemiology, the definition is given not by WHO. The definition is given by John M. Last. He's an epidemiologist. Okay. It is the distribution, study of distribution and determinants of health-related events. So study of distribution of population and determinants of health-related events in a population is known as epidemiology. Anyways, definition is not important. Let me come on the tools in epidemiology. There are 3 tools in epidemiology: rate, ratio, and proportion. Okay, what is rate? What is ratio? What is proportion? Let me explain you the meaning of that. Okay, in all of them, there is rate, there is ratio, and there is proportion. Now, in the entire community medicine, we have multiple formulas. I will tell you the formula of MMR, IMR, multiple formulas are there, So for each formula, whenever you see any formula, you have to tell me whether it is a rate, ratio, or proportion. So no need to learn. Please understand what do you mean by rate, ratio, and proportion. In each of them, there is a numerator and a denominator. Of course, we know that. In mathematics, you learn that. Now in rate, what is the thing? The numerator is a part of denominator. I will give you the example also. First, understand. The numerator is a part of denominator. That is the first thing. Number 2, the multiplier is not 100. It's never 100. Usually it is 1,000 or more than that. It can be 1,000, it can be 10,000, it can be 1 lakh, it can be anything. But it's never 100. And the third thing, there is a time specifier, which is usually 1 year. It can be 1 month, 1 year, anything, 10 years. But usually we take 1 year. This is rate. This is rate. Now in proportion also, the numerator is a part of denominator. You will say, ma'am, then what is the difference between rate and proportion? In both of them, you are saying the numerator is a part of denominator. But here the multiplier is 100. It's always 100. So we always take proportion in terms of percentage. And there is no time specifier. Here there is no time specifier. It is instantaneous in time. I will give the examples. First understand. Okay. Okay. Now coming on the ratio. In the ratio, the numerator and denominator are 2 different entities. They are not related to each other. Neither numerator is a part of denominator, nor denominator is a part of numerator. These are 2 different entities. There is no multiplier. There is no multiplier, neither 100 nor 1,000, no time specifier. This is ratio. Have you got it? How many of you got it? Now I will give you the examples of all three. I guess you understood the all three. So I'm teaching you three things: rate, ratio, proportion. Okay. In all of them, numerator, denominator, multiplier, and time specifier, we have to talk about that. Let's start with rate. Hannah, see the example. What is death rate? Can you see this is the example? See the death rate. What is death rate? What is the formula of death rate? See, death rate, the number of total deaths. For example, death rate of India. Death rate of India in 2022. The 2022 is already passed. है ना? So in 2022, from 1st January to 31st December, how many people are dead in India? है ना? So total number of deaths in 1 year. In 1 year means 2022. We can take any year. So from 1st January till 31st December, that is my time specifier. So that is the numerator. The denominator is the total population, mid-year population of that year. है ना? So the people who are dying are from the population only. They are not aliens. I mean, the numerator is a part of denominator. The people who are dead in 2022, they were from population only. So I can say the numerator is a part of denominator. You can say. And the multiplier is 1000, not 100. And there is a time specifier, that is 1 year. It can be any 2021, 22, 23 we cannot take because it is currently running. We don't know the total number of deaths till now. The complete year. Okay, so that is how we calculate. So here you can see the three things are satisfied. The numerator is a part of denominator, number one. The multiplier is 1000, number two, and there is a time specifier. So this is the definition of rate. How many of you got it? Everyone give me a thumbs up. This is a rate. You got it? What is rate? Everyone got it? Got it? What is rate? What is the meaning of the rate? You got it? Okay. So numerator is a part of denominator, number one. Number two, time specifier is there, which is usually 1 year, but it can be anything. And number three, multiplier is never 100. It can be 1000, 10,000, 1 like anything, but never 100, never 100. So that is the definition of the rate. Okay. We have seen the example also. Coming on the ratio. In ratio, the numerator and denominator are two random quantities. They are not at all related to each other. Neither numerator is a part of denominator, nor denominator is related to numerator. Example, in this class, total 100 students are there. For example, out of which the girls and boys ratio, if I say, the girls are 40 and boys are 60, just for example. So neither numerator is a part of denominator, nor denominator is a part of numerator. Both are different entities. So I will say 4:6. And now 40:60. That is a ratio. That is a ratio. Girls is to boys is 4:6, and boys is to girls is 6:4, whatever. So there is no multiplier, neither 100 nor 1000. There is no time specifier, and numerator and denominator are two different entities. But if I say how many girls out of total? So out of total, how many girls are there? Or how many boys are there out of total? So total is 100. And girls is 40 and boys is 60, whatever. So numerator is a part of denominator. The girls who are there in the class, they are from total students only. So again, numerator will be a part of denominator. And if I say the multiplier is 100, it will become proportion. My point is that if I say girls is to boys, if I say boys is to girl or girls is to boys, it is a ratio. Because numerator and denominator are not related to each other. But if I say boys upon total or girls upon total, and of course into 100, here also, then it will become proportion. How many of you got it? Because here the numerator and denominator are two different entities. But here in both of them, the numerator is a part of denominator and the multiplier is 100. How many of you got it? This will become a proportion. So here you can see the ratio I told you. So in ratio, the numerator is not a component of denominator. These are two different entities. There is no time interval. There is no time specifier. There is no multiplier. Neither 100 nor 1000. And lastly, proportion. Again, numerator is a part of denominator. See the example. But here multiplier will be 100. See the example. You can see the number of the children having scabies in a village. In a village, we go to a village. So total number of children in the village is the denominator. And the number of children having scabies in that total children is the numerator. So the children who have scabies are from total children only. The one who have the scabies, the disease, are from total children only. They are not aliens. So numerator is a part of denominator and the multiplier is 100. So multiplier is 100. So that's why it's a proportion. It's not 1000. It is in percentage. So numerator again a part of denominator and multiplier is 100, not 1000 like rate. And it is instantaneous in time. Time specifier is not very compulsory. If it's there, it's good. If it's not there, it's also good. But in rate, you always require a time specifier. How many of you got it? So we are done with three tools of epidemiology: the rate, ratio, and proportion. In all of them, let me summarize quickly, very quickly. In all of them, there is a numerator and there is a denominator in all of them. Okay, numerator and denominator is there in all of them. But how to differentiate all of them? In rate, the numerator is a part of denominator. There is a time specifier and multiplier is never 100, usually 1000. But can be 10,000, 1 lakh, anything, but never 100. In proportion also, the numerator is a part of denominator. Okay, and the multiplier here is 100. Okay, and there is no time specifier. It's always 100, it's always in percentage. But in ratio, numerator and denominator, they are not related to each other. These are random quantities, and there is no multiplier, no time specifier. I hope everyone got it. I hope. So in entire, just a minute, है ना? Okay, so you can see there are many formulas in entire PSM: the IMR, MMR, sex ratio, incidence, prevalence, case fatality rate, related risk. There are many formulas in entire PSM. So don't learn the formula. Whenever the corresponding formula will come, I will explain you. But don't learn whether it is a rate, ratio, and proportion. You can make it out. Looking at the formula itself, you can make it out. Is it a rate or ratio or proportion? So whenever all these formulas will come in entire PSM today, tomorrow, a day after tomorrow, I will make you remind that you have to calculate ratio or proportion. Got it? Got it? Can we go ahead? Now the examples will come. Okay. Sriniket, examples will come. Okay. So, okay. Read the question, tell me the answer. All of the following are true regarding ratio except. I'm asking except. Which of the following is not true regarding ratio? The numerator is a component of denominator. Numerator is not a component of denominator. Numerator and denominator are not related to each other, and it is expressed as a number. Which of the following is false? Yes, absolutely right. Aditi, Amu, Karthik, everyone is right. Very good. Please, everyone respond. I've explained you so nicely. Kindly respond. Kindly say the answer. Yes? So numerator is a component of denominator. This is wrong. Because numerator is not a component of denominator. I'm asking for ratio. Hannah, so this is wrong. Rest all the three statements are correct. I hope everyone got it. Why everyone is not replying? At least participate. No shake. B is not the answer. A is the answer. I hope you got it. Okay. So can we go ahead? So correct answer here is A because they are asking except. Hannah, which is not true for ratio. Rest all the three statements are true. Got it? Can we go ahead? Okay. So now coming on the next topic, we are done with the first topic, rate, ratio, proportion, the tools in epidemiology. Now I'm coming in measurements of epidemiology. I will teach you two things, mortality and morbidity measurement. First, tell me what is mortality, what is morbidity. Who will tell me what do you mean by mortality? Mortality matlab death. है ना? And what do you mean by morbidity? Morbidity matlab disease. Morbidity means disease. Got it? Got it? Yes, Shivangi, definitely the multiplier is only different in rate and proportion. Proportion is always percentage, rate is never percentage. And in rate, the time specifier is compulsory. In proportion, it's not compulsory. Okay? Yes, you are absolutely right, Shivangi. That's what I mean. So yes, now please tell me what is mortality, what is morbidity. Mortality is death and morbidity is the disease. Hannah, this is death, this is disease. Can we go ahead? So how to measure the mortality, how to measure the morbidity? The same definition. What is morbidity? It is disease. Any departure, subjective or objective, from well-being. That is a disease. That is a disease or sickness. That is morbidity. But what is mortality? It's death. The death is known as mortality. I hope you can understand. So first we will see the measurement of mortality, then we will see the measurement of morbidity. For mortality, I'm going to teach you 6 different indicators, 6 different measurements. For morbidity, there are only 2, the incidence and prevalence. So we will study them in detail, their formula, their numericals, everything. Okay, so let's start the measurements of mortality first. Let's start the measurements of mortality. How to measure the mortality? Let's talk about a country, any geographical area, let's say India. Let's take a time specifier 1 year. So I will always talk about 2022 because it is already past. And when I say 2022, I always mean I'm talking about from 1st January till 31st December, the complete year I'm talking about. So tell me the mortality of India. What is the mortality? What is the mortality of India in 2022? That is my question. What is the mortality of India in 2022? I'm asking you, what is the mortality of India in 2022? How to calculate? How to calculate? What are the ways you calculate? So there are 6 different ways we can calculate. Let me explain you how. So there is crude death rate, it is known as CDR. There is specific death rate known as SDR. There is proportional mortality rate known as PMR. There is survival rate known as SR. There is case fatality rate known as CFR. And there is standardized mortality rate known as SMR. So you have to use these terminologies, CDR, SDR, PMR, SR, CFR, SMR, because it will come in your exam. CFR, they will not give you full form sometimes. You should be knowing that what is the full form. Hannah? So I'm going to teach you one by one all these. You will understand. है ना, don't mug up, you will understand everything. We will start with the first one, crude death rate, है ना. I want you to make this table with me if you wish, है ना. So here we will write the formula for each of them. Okay, here we will write the definition, formula, and here we will write this thing, like important points regarding that. I will fill this table with you. So let's start with the first one, CDR, crude death rate. What is crude death rate? Who will tell me what is crude death rate? The first is always crude death rate, CDR, crude death rate, CDR, है ना, crude death rate. Let me tell you, the denominator is the total mid-year population of that country. What is mid-year population? Let's talk about the same country, India, है ना. Let's talk about the same year, 2022. So from 1st January till 31st December, what is the mid-year population of India? How to calculate it? Listen, population is changing every second, rather I will say every millisecond. We are talking with each other. Many people are dying, many people are taking birth. So every second the population is changing. It's dynamic, it's not static. है ना? So in the complete year, what population you will take? Every year it is changing. Every year, nahi, every second it is changing. So we have to decide something now. So what is the mid-year? है ना? There are 12 months. So we take the mid-year at 1st July. 1st July is nearly at the center. Not exactly, but nearly at the central day of the complete year. 1st July. है ना? It comes at the center. 6 month here, 6 month here. Broadly. Okay. So 1st July. 1st July, 12 baje. है ना? 0000 we say. 0000. This is the snapshot we take. We are taking a snapshot. At this moment, whatever is the population considered as mid-year population of that year. Mid-year. That's why it is known as mid-year. Naam mein hi hai, middle of the year population. That is on 1st July, 0000. है ना? At 12 a.m. 1st July. What is the snapshot of population? 1 second after the population will be different, or 1 second before the population will be different. So at this moment, whatever is the population of that year for that country, we consider mid-year population of that year. Say yes. Say yes. So that is an average reflecting the complete year we will consider. Say something. Okay. Yes. So this is the meaning. So mid-year population is the denominator, है ना? And how many people are dying in 2022? Total number of deaths. That is the numerator. You tell me, है ना? So in 2022, imagine 2022 India last year. So what is the population of India in 2022? On 1st July, take it as denominator. That is the mid-year population in the denominator. And how many people were dead from 1st January till 31st December? How many people dead in India in 2022? That is your numerator. And the multiplier is 1000. You tell me, what is it? Is it a rate, ratio, proportion? I'm asking you. What is it? Is it a rate, ratio? See, what is the numerator? Number of people dying. And what is the denominator? Mid-year population. So the number of people who are dying are a part of population who they are not aliens, I mean. है ना? So numerator is a part of denominator. Got it? And the multiplier is 1000. And there is a time specifier. So it is a rate. Very good. It is a rate. So it is an example of rate. है ना? So learn the formula and learn, say its rate. Why it is known as crude? Crude का क्या मतलब है? Crude मतलब include everything. सब कुछ. Total का मतलब होता है crude. So it is including all the death. Now whether the death is due to TB, due to diabetes, due to MI, due to heart attack, due to suicide, due to homicide, due to murder, no, due to anything, all the deaths we are including. Whether the death is of a male or a female or a child or an adult, all the deaths we are including. So that is the meaning of the crude. So crude means everything. We are not specifying the gender. We are not specifying the cause of the death, not specifying the age group of the death. All the deaths we are including. That is the meaning of the crude. This is the simplest measure. Out of the 6, this one is the simplest. Here the population is mid-year population, that is taken on 1st July. That is the denominator. And it is a rate. Say it is a rate. Got it? So this is the first thing. Okay, this is the first thing. Okay, so the denominator, Tanu, it's the mid-year population I told you. Mid-year population is the population of the country which we take on 1st July. That is the mid-year population. Okay, the complete year ka middle, that is the mid-year population. Got it? So that is the thing. Now coming on the second indicator. The second indicator is the SDR, specific death rate. What do you mean by specific? Now we will specify. Now out of the total death, the denominator is the mid-year population only. Here also I will take the denominator as mid-year population. But here I was taking all death. In crude death rate, I was taking all death. That's why I was saying it's crude death rate, because it is including all the death. But in specific death rate, I will not take all death. I will specify which death. Death due to TB, death due to diabetes, death in male, death in female. So I can specify the gender, I can specify the cause, I can specify the age group, the death in the infant, the death in the adult. So I can specify a particular group. Sirf uska death, not all death. That is the meaning of specificity. The specificity is related to the cause of death. The specificity is related to the gender. The specificity is related to the age group. any specific thing I'm saying. It is not all death. Death due to TB is a specific cause. Death in males is a specific gender, and death in infants or in adults or elderly, it is a specific age group. You got my point? So here it's also same. Here also multiplier is 1000 in 1 year. Here also multiplier is 1000 in 1 year. But see the meaning of the crude and specific. The name itself depict, याद करने की जरूरत नहीं है, नाम में ही है. Crude मतलब सब कुछ और specific मतलब सब कुछ नहीं. जो हम पूछ रहे हैं सिर्फ उतना बताओ. Specific. That is the meaning, है ना? So how many of you got it? How many of you got it? So see the formula of SDR. Okay, make it 1000, not 100. Okay, you can see the denominator is same. It's mid-year population, but the numerator contain the number of death, not all death, but a specific death. But a specific death, है ना? The specific death can be cause specific, time specific, है ना? Age group specific, gender specific. Like, see the example. See this example. Can you see? What is the denominator? Say mid-year population. Denominator is mid-year population. What is the numerator? Number of death due to diabetes in 2022 in 1 year. I'm saying only diabetes wala death, not all death. Got it? Only diabetes wala. Yes, it is also a rate. Absolutely right. Sriniket, it's also a rate. Hai na? So there is a specific cause I'm saying. See this one. Again, the denominator is the mid-year population, but the numerator is number of death in 1 year. So specific age group I'm giving. Hai na? Here also you can see mid-year population, number of death only in March. So specific period I'm saying. So I'm not saying all death. I'm saying something specific. That is SDR. Hai na? So here it will be easy to do the comparison between different causes. So I can do the comparison. This is mid-year population, mid-year population, mid-year population. Okay. The death due to TB, the death due to diabetes, the death due to MI. I can do the comparison of the different deaths. So for comparison, this is better. Okay. For comparison, this is better. The third one is the PMR, proportional mortality rate. Till now, what we have learned, let me tell you. CDR we have seen, SDR we have seen, crude death rate, है ना? Specific death rate. Now proportional mortality rate. The third I'm going to tell you. है ना? You have to see what is the numerator, what is the denominator. That is the important. And who is the multiplier. है ना? That will decide is it rate, ratio or proportion. Got it? Listen. Here what was the denominator? Mid-year population. And the numerator include all death. Okay ji? है ना? Here the denominator include again mid-year population. But numerator do not include all death. It include only specific death. The specific cause, specific gender, specific age, specific period, anything specific. Say yes, say yes. Here also multiplier was 1000. Here also multiplier was 1000. That's why this was a rate and this was also a rate. Do you have any problem in that? These both are same, hai na? But only thing this is crude, this is specific. So I told you this is the simplest measure. And I told you this is a measure for comparison. For comparison, this is good. Hai na? I told you one important point regarding that. Say something, react, people react. Hai na? Now come on, PMR, proportional mortality rate. It is death upon death. I learned like that. The denominator is not mid-year population. The denominator is the total death in 2022. In 2022, India mein total death kitni hui thi? Write the number in the denominator. Don't write population. Out of that, TB mein se kitni death hui? Out of that, diabetes ki kitni death hui? Out of that, hai na? Suicidal death kitni hai? So specific death. So it's death upon death. Hai na? It's death upon death. Hai na? So a specific death out of the total death. Hai na? So total death, out of the total death, how many deaths are due to MI? How many due to diabetes? How many due to suicide? How many due to volcano eruption? Anything. How many due to earthquake? Whatever. You can say any specificity. Say yes. Huh? So numerator again a part of denominator, but I'm saying the multiplier is 100, not 1000. So it is a proportion. Naam mein hi hai, proportional mortality rate. So it's not a rate. Although it is a rate, I'm saying it's a rate. It's a misnomer. It's not rate. It's proportion. It's proportional mortality rate. How many of you got it? How many of you got it? Say something, react, say yes or no. Huh? It is good for telling the burden of disease. The best indicator to tell the burden of disease. So we will see out of the total death, maximum death is due to which cause? Hai na? Total death. For example, in India, whatever is the number of the total death in 2022. Hai na? Out of that, the maximum death we have seen it is due to MI. So MI is having biggest burden on the country as a death. The second cause is stroke. The third cause was the suicide. Whatever. This sequence is not real. I'm just telling you. So this is an indicator to tell the burden of the disease. So they ask you the simplest indicator, go with CDR. They ask you an indicator which is good for comparison, go with SDR. They ask you, tell me an indicator which tells the burden of the disease, say PMR. You should know the formula of all of them so that you can identify, and you should know the multiplier of all of them. You can tell whether it is a rate, ratio, or proportion. Everyone with me till now? So we are done with 3 till now. Okay, read what is PMR in front of you. है ना? You can see it is the number of death out of total death into 100, है ना? You can see this thing, है ना? This thing I am saying. So the denominator is the total death in the country. The numerator is the number of death due to a specific disease, है ना? Due to a specific disease, due to TB, due to diabetes. So it is death upon death. The denominator is not mid-year population. The denominator is the total death. That's why it's a proportion. It's not rate. The multiplier is also 100. है ना? It will tell us the burden of the disease. It is a good indicator when mid-year population is not known. You can use this indicator. Okay. The next two I will take together. Till now we have done with 3. है ना? So we will enumerate these 3 and go on the 4th and 5th together. Okay. So first I taught you. Can you please help me? Huh? Can you please help me? The first I taught you is CDR. Okay. The second I taught you is SDR. Crude death rate, specific death rate. है ना? And the third I taught you is proportional mortality rate, PMR. Till now I taught you these 3. Okay. Till now we have done these 3. Okay. Now I am going to teach you next 2. है ना? Survival rate and case fatality rate. I will take these 2 together because they are related. Both of them are related. I will tell you these 2 together. Okay. So let me tell you what I mean here. What I mean. So here the denominator is mid-year population. Here also the denominator is mid-year population. Both of them are closely related. The only difference, the name itself indicates this is crude, this is specific. Since it is crude, it includes all death. And since it is specific, it includes only specific death, not all death. But in both of them, the numerator is a part of denominator. In both of them, it's 1000. The multiplier is 1000. That's why both of them is rate and rate. There is no problem in that. The third I taught you is PMR. And it's proportion. The name itself depicts its proportion. Proportion mortality rate. Don't say rate. It's a proportion. It's a misnomer, you can say. So here it's death upon death. The denominator is not mid-year population. It's total death. And the numerator is the specific death. Specific death out of the total death. Death due to TB, death due to diabetes, death due to anything. But the multiplier is 100. And that's why this one is a proportion. I already taught you. I guess everyone is with me till now. Now see the next 2. You have to concentrate on the denominator. Here mid-year population. Here mid-year population. But here total death. Numerator will always be death. Okay. Now coming on 4th and 5th. In 4th and 5th, neither the denominator is mid-year population nor the denominator is death. So what is the denominator? It's the cases, total cases of that disease, particular disease, total patients or cases you say. Take any disease, say any disease of your choice, say TB. Okay? So total cases of TB in India in 2022, that is the denominator. That is the denominator. How many of them are surviving after 10 years? That is survival rate. How many of them are alive or they are surviving? It is usually used for cancer. Survival. How many of them are surviving in 5 years or 10 years? We take 5-year or 10-year timeline. That is the survival rate. And opposite of that is case fatality rate. How many of them are dying? The death is occurring after 10 years. That is the case fatality rate. Let's take example of brain cancer. Okay, let's take an example. Brain cancer. For example, brain cancer. Okay, in brain cancer, for example, after 10 years, whatever patients you are having, after 10 years, only 20% survive, 80% die. Obviously, if 20% are surviving, so 10% are dying, 80% are dying. So I'm saying the survival rate here is 20%. And this case fatality rate is 80%. So I'm saying after 10 years, total patient may say how many are surviving is the survival rate. And how many are dying, that is the case fatality rate. And these two are opposite of each other. And total of both of them is 1. So you can get the 1 by subtracting the other from 1. So if I tell you this is 20%, it's 0.2. Now 20% matlab kya? 20 upon 100, it's 0.2. So this one is obviously 0.8. Now total is always 1. How many of you got it? These two are complementary to each other. You can say survival rate is a positive indicator, case fatality rate is a negative indicator, but both represent the same thing. Usually used for cancer studies. Say yes, say no, say something. And both of them, the multiplier is 100 in both of them. So both of them are proportion. Both of them, the numerator is a part of denominator. The one who are surviving are from cases only. The one who are dying are from cases only. So the numerator is a part of denominator in both of them. But in both of them, the multiplier is 100. That's why both of them are proportion. There is no doubt in that. I guess everyone got it. Everyone got it. So can I say what does they represent? आपको बताना है कि represent क्या कर रहा है. सबसे पहले बताओ crude death rate. What does it represent? Say ma'am, it is the simplest indicator. Not good, but simplest. Because it is including all the death. That's why it is the worst indicator, I must say. But it is the simplest to calculate. What about specific death rate? You will say, ma'am, it's good for comparison. Okay, because we can take different specific deaths. Okay, in PMR, it's good for burden of disease. If you want to tell me the burden of disease, the best indicator is PMR. Survival rate will tell you, number one, the prognosis of the disease. If I'm saying the survival rate for brain cancer is only 20%, you will say, "Ma'am, prognosis is not good. After 20 years or 10 years, only 20% of the patient are surviving." So prognosis of the disease is not good. Number one, you can comment on prognosis based on survival rate. Number two, you can tell me the standard of therapy. The therapy is available or not, the yardstick of the therapy is available or not available. Because the survival rate is only 20%, you can understand matlab zyada treatment is not available. That's why people are dying now. They are not surviving because therapy is not available, not good therapy we are having. It is indicating a yardstick of the prognosis and yardstick of the therapy, the survival rate. The survival rate, two main things are, it is giving an indication of the therapy and it is giving an indication of the prognosis, therapy or treatment. Okay, case fatality rate. More is the case fatality rate, more is the virulence of the disease. It is indicating the virulence or it is indicating the killing power of the disease. You may say killing power of the disease. Virulence of the disease or killing power of the disease is indicated by CFR. So learn the important, what does they represent. I will show you the table in the end, don't worry. You got it? So let's come on the two together. First survival rate, then case fatality rate. What is survival rate? Look at the formula directly. Don't read the definition. Definition से कोई मतलब नहीं है. Look at the formula. What is the denominator? Total number of cases. What is the numerator? Number of patients alive after 5 year, 10 year, whatever time zone you are taking. So out of the total patients, how many are alive? That is survival rate. How many are surviving? है ना? The multiplier is 100. Okay. So it is a proportion, as I told you. It is telling the prognosis of disease. It is telling the standard of the therapy, and it is useful for cancer studies. That is survival rate. And case fatality rate, it's reverse. You can see. Again, the denominator is the cases, Hana, but the numerator, how many of them are dying, not surviving after 10 years? How many are dying? Multiplier here is also 100. So can I say this is a complementary of survival rate? Huh? If survival rate is 20%, so obviously this one is 80%. Obviously, these are complementary. The sum of both of them is 1. Hana, can I say SR plus CFR is equal to 1? 1 matlab 100, total 100% hoga. Ye 20 hai, to ye 80 hoga. I mean that. Okay, Hana. So what does it represent? It represents the virulence of the disease, killing power of the disease. Say yes. Got it? So this is what I taught you till now, the 5 indices. How many of you can see this table? Can we revise this table together? The 6th one I will tell you now last. It is difficult. That's why first summarize the 5. First summarize the 5. Can you please tell me? Huh? So here I have written the formula. I have told you, is it rate, ratio, or proportion? And here the important points regarding that. Please learn this table thoroughly. You get many questions of that. What we are studying, by the way, what are these 6 things? What we are studying? Huh? We are studying the indicators of mortality. These are the 6 indicators of mortality. How to measure mortality? We are having 6 indicators with us. We can do so with the help of 6 indicators. Okay, ji? Hana? So see, let's start one by one. The first is crude death rate, CDR, crude. So denominator is mid-year population. Numerator is the number of total death. And multiplier is 1000. That's why it's a rate. This is the crude. That's why simplest and it includes all. The population is measured on 1st July, we know. The second is SDR. SDR is specific. So here also the denominator is mid-year population. But the numerator is the specific death. It's not all death. It's specific death. And the multiplier here also it's 1000. It is also a rate. It is good for comparison. Say yes. The third is the PMR. It's death upon death. The denominator is total death, not mid-year population. And that numerator is the specific death. The multiplier is also 100. That's why it's a proportion. It will indicate the burden of the disease. And no need to learn. You have to understand. If you try to mug up, you will forget everything. Believe me. And these two you have to take together. The denominator in both of them is patient, patient. The numerator is number of patients surviving. The numerator is number of patients dying after 10 years. Multiplier is 100, 100. That's why proportion. The survival rate indicates prognosis and therapy. Case fatality rate indicates killing power and virulence. Everyone with me? Anyone having any trouble in understanding? So please tell me. So we are done with 5. 6th I will tell you later on. But you are done with the 5. What is SDR? What is CDR? What is PMR? What is survival rate? SR? What is case fatality rate? CFR? Tell me, say something. You want me to write again or you got it? You want me to say again, write again, or you all got it? We will solve some MCQs in that case. Okay, quickly. Quickly we will do. You tell me the name CDR. You tell me SDR, PMR, survival rate and case fatality rate. I guess everyone got it. You just tell me the numerator and denominator of each of them. That's it. And the multiplier. Numerator, denominator, multiplier. Multiplier we will say in the end. Based on that, we will say rate, ratio, or proportion. Okay. So first tell me the numerator. First tell me the denominator. Here the denominator is mid-year population. Here also the denominator is mid-year population. Both of them are almost same. But here, since it is crude, that's why all death. And since it is specific, that's why not all death, only specific death. Please understand a little bit difference between them. Okay. The next is the PMR, as I told you. So here the denominator is total death. And the numerator is the specific death out of the total death. I explained you the meaning of that. Okay. The next two I told you, SR and CFR are related to each other. The denominator is cases or patient. Here also cases or patient. Out of the total patient, how many are surviving after 5 years? How many are dying after 5 years? Out of 10 years, 5 years. So this is how you calculate survival rate and case fatality rate. Both are complementary to each other. Say the multiplier of all of them. Here the multiplier is 1000. Here also 1000. Here 100, 100, 100. So can I say this one is a rate, this one is a rate, this is proportion, proportion, proportion. This is how you have to go. This is how slowly you have to learn. And tell me the main point of each of them. So here main point is that it is simplest. The crude death rate is simplest. That's it. Okay. SDR ka main point here, it is good for comparison. It is good for comparison. You can understand. PMR ka good point here कि it tell us the burden of the disease. Which disease have how much burden out of the total death, maximum death is contributed by which one? The second contributor is which one? The third. So it is telling the burden of each disease on the death. The survival rate is a positive indicator that indicates the therapy, whether treatment is available, not available, prognosis is good or not good. We can comment on that. And CFR is a negative indicator that indicates the killing power, that indicates the virulence. Okay, so please understand the relevance of all these. Okay, if you're ready, we will solve some questions. But I want each of you to answer. Otherwise, I will throw you out, really. So if I'm teaching you so nicely, it's your responsibility to give the answers. Okay, no. Following can be used as a yardstick for assessment of standard of therapy. That is treatment. Standard of therapy or treatment. Is it specific death rate? Is it case fatality rate? Is it proportional mortality rate? Is it survival rate? You tell me. Which tell us regarding the therapy? Can we comment on the therapy of that drug is available, that disease is available or not available? We can comment looking at what indicator? Yes, it's survival rate. Very good, very good. So if I change the question, currently the answer is survival rate. So if I change the question, standard of prognosis, can you comment on prognosis of a disease? Whether the disease prognosis is good or bad. So what is the answer for prognosis? If I ask you the same question for prognosis, would you like to change your answer or it is same? So therapy and prognosis, both are indicated by survival rate. Still my answer is same. In that case also my answer is same. Not A. Why you are changing your answer, Pritesh, Aditi? Many people looking at each other. No. What you people are saying? Why you people are saying A? I will kill you. Why you are saying A? I told you the two relevance of survival rate. No? Here you see the yardstick of the therapy and the prognosis. Both is indicated by survival rate. So whether I ask you the therapy or whether I ask you the survival prognosis, the answer is survival rate. Got it? Got it? All those who were saying A. Got it? You realized your mistake. So please don't do mistake in the exam. Please learn. The therapy as well as prognosis, both of them. Okay? The answer is survival rate. Yes. Can we go ahead? The next question is in front of you. Estimating the burden of a disease is done by which indicator? Is it proportional mortality rate? Is it disease-specific mortality rate? Is it crude death rate? Or is it incidence of the disease? The burden of the disease is indicated by what? Tell me the burden of disease kaun batata hai among them. What is the correct answer? I'm asking. Be fast to answer. Yes, you all are right. The PMR is the correct answer. Okay, the correct answer here is the PMR, proportional mortality rate. Very good. The next question is in front of you. Most useful indicator to predict the virulence of a disease. Can you comment on the virulence of disease? Based on what indicator? Is it standardized mortality rate, SMR? Is it case fatality rate, CFR? Is it secondary attack rate, SAR? Or is it incidence? I'm asking the virulence or the killing power of a disease. Both are indicated by killing power pe bhi PYQ hai. So answer is same. It's CFR, case fatality rate. So correct answer is case fatality rate. The next is proportional mortality rate is what? Is it a rate, ratio, proportion? See here it is proportion, here it is rate. So would you like to go with rate or proportion? What is the correct answer? If you know the formula, you can answer it easily. The denominator, it's death upon death. So denominator is total death. and the numerator is the specific death out of total death. है ना? So death due to TB out of total death. Death due to diabetes out of total death, but the multiplier is 100. Now you tell me what is the correct answer? Since the multiplier is 100 and numerator is a part of denominator, I will go with proportion. So correct answer is proportion. Although here rate is written, it's a misnomer. Actually, it's a proportion. So correct answer is C, and you all are right. Very commonly asked question, because students get confused looking at this. They say it's rate. Anna? So don't get confused. Can we go ahead? Denominator in calculation of case fatality rate is. Tell me the denominator of case fatality rate. What is the denominator? It is total number of death. It is total number of hospital admission. It is total number of cases due to disease, or it is total number of death due to the disease. What is the correct answer? I am asking denominator of CFR. Case fatality rate का denominator क्या है? The survival rate and case fatality rate दोनों का denominator same था. It's the patients or cases. You all are right. The correct answer is C. है ना? So if I change the question from case fatality rate to survival rate, also answer is same. But if I change the question to PMR, what is the denominator of PMR? Now please change your answer. What is the denominator of PMR? I'm asking. PMR क्या था? Read the options and tell me the denominator. In that case, what is your answer? What is PMR? Yes, very good, very good. Total number of death. It is death upon death. Total number of death is the denominator, and out of which how many death due to specific cause. So in that case, the answer will become A. So they can ask you anything, literally anything. है ना? You should be prepared for all. You get many questions from the PSM. How many of you got it? Can we go ahead? Can we go ahead? So this is the thing. Can we go ahead? है ना? So we are done with 5 indicators till now. Okay, the 6th and the last one. None of them is best. The 6th and the last one, which I'm going to teach you now, this is the best one. The simplest is CDR, but not the best. The best is SMR. What is the best one? The 6th one, the last one. It's standardized mortality rate. It is known as SMR. Standardized mortality rate, known as SMR. What do you mean by standardization? What is the standardized or standardization? Suppose there are two countries, country A or country B, or two places, geographical places, है ना? Just say two cities, Delhi and Hyderabad, or any two cities, A and B. Okay, I want to compare the mortality here and mortality here, and the one which is having lower mortality, है ना? I will consider their health services are good. Just suppose your mortality is low, so I will say A city, A geographical area is good because here mortality कम लोग मर रहे हैं, है ना? मतलब health services are good here, good doctors, good hospitals, good services, है ना? And here mortality is high. So that's why here health services are not very good. This is not a good country to live, good place to live, है ना? So I want to compare the mortality of the two places. What should I do? How should I compare? I'm asking you. How should I compare? I'm asking you. What is the best way to compare the mortality of the two? I told you the indicators now. So most of the students say, ma'am, do CDR here and do CDR here. I know. What is CDR? True death rate. So you just calculate the CDR here. You know the population of A. Take it denominator. Population of B. Mid-year population of B. Take it as a denominator. Just a second. है ना? Just a second. है ना? And the numerator, number of death here in 1 year, and the numerator, number of death in 1 year. It includes all death, है ना? And looking at the CDR, you can comment कि CDR is less or more. You can do the comparison. Many students say this. You also think this. I also think like this, है ना? But CDR is not a good indicator to do the comparison. You know, mortality किसकी होती है? Which people die? You will say, ma'am, either old people die after 70s, 80s, eventually everyone dies. There is no one who is immortal on this earth. Hana, you will also die, I will also die, everyone will die one day. Okay, eventually, one day. So, you know, so after old age, everyone dies. Okay, so there is more death in old age, or else death is more in infancy. Hana, in extremes, the death is more. Both are fragile group. In extremes, either very high age or very low age. है ना? In extremes. So maybe you are getting, for example, I'm calculating CDR both the ways. Here CDR is more, here CDR is less. For example, here answer is 11, here is 8. So my conclusion will be A city is not good, B city is good, here mortality is less. Here mortality is more, very high, it's not good to live. है ना? Because here mortality is high. I can conclude that. But maybe it is not real. It is not reality. Maybe here mortality is high because here old people are very high. And infants are very high in number, and maybe here it is less because here old age, here maximum population is young only, neither old and nor infancy. So it is not a good indicator, you know. So you can get the false result and you can conclude falsely. So CDR includes all that. That's why it's not a good indicator. Say yes, you got it. So before comparing, you have to do the standardization. What you have to do? Standardization. After that, the two things will become comparable. Currently, the two population are not at all comparable because their population split is different. In this population, old people and infants are more. In this population, old and infants are less. So how you can do the comparison? And death is directly related to age. We all know old people die. Young people don't die usually. है ना? Old people die and infants usually die. है ना? Because they are very fragile. But we know if a population have maximum young, so how can we compare the two population? First, we have to do the standardization before comparing. This is the meaning of standardization. Got it? Ideally, standardization should be done for everything. है ना? Here I am doing standardization for age. Age group should be comparable, then only we can do the comparison. Here also same age group, here also same age group, then we can do the comparison. So first do the standardization of age. But not only this, you will say, ma'am, here males are more, here females are more, and here Hindus are more, here Muslims are more. Anything can be possible, no? Anything. I cannot do standardization for everything. Ideally, standardization should be for everything, for age, for gender, for religion, for everything. But we cannot do standardization for everything. So best to standardize is the age. Minimum age to standardize karna hi karna hai. That is the biggest factor that affects the mortality. How many of you got it? So that is the meaning of standardized mortality rate. We will do the standardization. So you will say, ma'am, how you will do the standardization? I will take a third population. The third population acts as a control population. That will be applicable on both. You got my point? So I'm having population A. I'm having population B. Both of them have different age groups. I mean 0 to 5, 5 to 10, 10 to 20, 20 to 30, 30 to 40, 40 to 50 years, and 50 years above. So I will write the population, how many people in each group. And here also I will do the same split. है ना? So here numbers are different, here numbers are different. Maybe in which group, here young people are more, here old are more. Whatever is the possibility. ठीक है? Let's take a third population, a control population. है ना? The third population. It is standardized population. I will call it standardized population. It is known. It is known to us. है ना? So third population, it is any population. You can take the national population also. Standardized population are available. The tables are available. है ना? They will be given to you. This is standardized population. है ना? So apply the death rate of this population on this population as well as this population first. है ना? So the age groups will be comparable, and after that you can compare the CDR of both. You got my point? You got my point? Okay. Sheikh, I'm saying age has to be standardized. Why you are writing age does not need to be standardized? Age has to be standardized now. That's why ye sab matapodi kar rahe hain. Age group is different. In one population, young is more. In one population, old is more. I do not want that. I want to standardize. So that's why I'm using a third population in which the split is common. So I will apply the death rate of this on this, death rate of this on this, and then I will do the comparison. So this is my third population. And then I will do the comparison. Now don't do the calculation. Nobody is going to ask you the calculation. Just learn the meaning of the standardization. Okay, this is the meaning of the standardization. If you want to compare the death rate of the two population with different age composition, CDR is not a good indicator. Learn that. If you want to do the comparison, you have to do the standardization. Standardized death rate is the best indicator. Hannah, if you want to do the comparison. So age is the confounding factor. You have to standardize the age. You have to standardize the age by taking a third population. This is my third population. For example, don't learn, just have a look. I'm having two population X and Y. I'm taking a third population that is standard population. है ना? So see how I do this is my standard population. Okay. So this is my population X. This is my, so don't go in the numerical. Just I will take a third population and apply the death rate of both the population on standard one. And then I will do the comparison. Nobody is going to ask you the numericals. Okay. So please learn the meaning of the standardization, and this is the best indicator among the six. So I taught you there are 6 indicators: CDR, crude death rate, SDR, specific death rate, PMR, proportional mortality rate, SR, survival rate, CFR, case fatality rate, and the last one I taught you is SMR. SMR. So tell me which is the simplest one. Answer is CDR. And tell me which is the best one. It's SMR. Why this one is best? Because here we are doing standardization of age. Ideally, standardization should be for everything, but we cannot do standardization for everything. So we standardize age at least. How you do this standardization? By taking a third population. The third population is standard population. It can be national population. Anna. That's it. That's the most important thing you have to learn here. Can we go ahead? Can we go ahead? So this is the best one. So learn the relevance of all things. This one is the simplest. This one is good for comparison. This one indicates the burden of disease. This one indicates the prognosis and the therapy, standard of therapy. This one indicates the killing power. This one indicates the virulence. And this one is the best one. To compare two populations with different age group, we can do the comparison. How many of you got it? Learn the relevance. Okay, can we go ahead? Okay, read the question, tell me the answer. which is the best in the order to make a comparison between two population. You have two different population, you want to compare them. You want to compare the health status of a two population. Is it standard mortality rate? Is it specific death rate, proportional mortality rate, or age specific death rate? I'm asking. Okay, I'm asking. What is the correct answer? No, Aditi, you don't have need to learn the formula of SMR. Okay, what is the correct answer? The correct answer here is A. Standard mortality rate, SMR. Okay, SMR. Got it? So standard mortality rate is nothing. Actually, you can understand observed death is the real death and expected death is the death we will calculate in the standard population. We just do the ratio of that. So nobody is going to ask you the numerical or question on that. But you should know this is the best indicator. So for age standardization, it is the best indicator. This is the relevance. Learn the relevance of all of them. The master table is in front of you. The master table. Yes, SMR formula is not same as that of CDR Sriniket. You will calculate observed death like CDR and expected death by CDR. Observed death is your CDR only. And expected death, you calculate the CDR in standard population. Got my point? And you will do the ratio of that. Okay, these two are two different CDR and you are comparing the two CDRs. Okay, that is the thing. So ultimately, this is the master table in front of you. How many of you got it? The 6 indicators of the mortality, they are in front of you. You should know their formula. You should know whether they are rate, ratio, and proportion, and you should know the relevance of each of them. That's it. You get many questions on that. We are done with indicators of mortality. Everyone give me a thumbs up. Everyone give me a thumbs up. You got it? Everyone got it? So if two populations are there with different age group and you want to compare them, the best indicator is SMR. Okay, we do that. That is standard mortality rate. Got it? Can we go ahead? Everyone, people are not responding. I don't know why. Say something, people. Huh? Okay, so got it. Hana, so we are done with mortality, I guess. We are done with mortality, the indicators of mortality. Hana, the 6 indicators of mortality. I don't think I need to revise this table. You know the 6 indicators, you know the formula of each of them, the numerator, the denominator. You see the multiplier also, whether it is a rate, ratio, proportion, you understand that also, and important one-liner points on that. That's it. That's it. Okay. Now, the death certificate. Whenever a death occurs, death certificate is made. You are a doctor. People will come to you. Doctor, there is a death at my home. Can you please make a death certificate? Hana? Without death certificate, the cremation is not allowed nowadays. It is compulsory. It is compulsory. The death certificate should be made of the dead body. Okay, so death certificate is compulsory. So you should be aware that how many columns are there, what to fill. So you will fill the details of the deceased person, the person who already passed. Okay, the name, the age, and the address, and that though whatever that detail will be filled. But what actually you have to fill in the death certificate, the cause of death. You have to fill the cause of the death. So how many lines are there? So WHO has recommended an international death certificate. Death certificate do not vary from country to country. It's not there in India it's different, in US it's different. Throughout the world the death certificate is same. There are 4 lines. I will tell you the 4 lines you have to fill. So for national and international comparison, okay, for national and international comparison for uniform and standardized system, the international death certificate is there. So let me tell you what is international death certificate. It looks like this. Can you see? In this, you can see how many lines we are having. We are having line 1. Line 1. Okay, line 1. And after that, we are having line, 1A, 1B, 1C, and sometimes 1D also, not always, and line 2. Line 2 is only 1. Okay, so total 4 or 5 lines are there. This compulsorily A, B, C you have to fill. D is not compulsory to fill. And if you wish, it's voluntary, you can fill out also. And 2 also you have to fill. So these are the 5 lines are there you have to fill. Now what you have to fill in on each line, let me explain. So first line we have 1A, 1B, 1C, 1D, and 2. These are the 5 lines we have to fill on a death certificate. Let me explain you what does it mean. Okay, got it? So let me explain. Let's take an example. There are 2 examples. Let's see at the example number 1. Imagine there is a person who is dead. Immediately who is dead, the reason for the death is renal failure. The kidneys, bilateral kidneys undergo failure. The kidneys are non-functional. Both the kidneys. Suddenly, acute renal injury. You will say, ma'am, why the kidneys are non-functional? So currently, what is the acute cause of death? Bhai, mara kyun? Kidney fail ho gayi. है ना? Why the kidneys were failed? Kidney तो ऐसे ही किसी की भी fail नहीं होती ना. There may be some disease in the kidney. What is the disease in the kidney? The disease in the kidney is diabetic nephropathy. And you know diabetes is a disease in which patients have hyperglycemia. For years and years, the glucose is raised and glucose destroys 3 organs. gradually. The kidneys, that is nephropathy, the nerves in the body, that is neuropathy, and the retina of the eye, retinopathy. These are the complications of the diabetes. So the sugar, the raised glucose should be controlled with the help of medicines or insulin. If someone is not taking the medicine and glucose is constantly raised for 5 years, 10 years, 20 years, so gradually the three organs get damaged. And the disease is known as nephropathy, neuropathy, retinopathy. So I'm talking about, imagine there is a person who is having diabetes. Due to the diabetes, both the kidneys are failed. Hai, the disease in the kidney is diabetic nephropathy. But why the person have diabetic nephropathy? The main disease is diabetes. So who's the main cause of the death? Mara kyun? Diabetes ki wajah se. So diabetes ki wajah se kyun mara? The kidneys were affected. The kidneys were having nephropathy. And due to the kidneys were having nephropathy, they undergo failure. So the actual cause of the death, I mean the instant cause of the death, currently there is a person who is dead. So instantaneously on this second, what happened to this person? So the person is dead. So the person is having renal failure. But renal failure kyun hua? What is the antecedent cause due to diabetic nephropathy? What is the antecedent cause of diabetic nephropathy? So that is diabetes. So main cause is diabetes. You got my point? Are you getting it? Say yes or no. So main underlying disease on 1C or sometime on 1D also, the main underlying disease. So that's why 1C or 1D is the essence of death certificate. The main cause is there. Got my point? How many of you got it? So basically on 1A, you have to write down the disease or the condition directly leading to death on this second. But this cannot be directly, no? It can be due to some cause. This also can be due to some cause. So you have to write the underlying causes one below the other like that. What about line 2? Line 2 should contain all other diseases the person have. Now this person have hypertension also. This person have this also, cataract also. But this is not related to cause of death. So although these diseases were also present in this person, Anna, but this is not directly related to the cause of death. You should mention them on line number 2. Okay, on line number 2. Okay, let me finish it, Sasika. I'm in the middle of something. Let me finish. I will answer your queries. I'm having an eye on that. Let me finish. Okay, you got it. This is the death certificate. You got the 4 lines of the death certificate: 1A, 1B, 1C, 1D, and 2. What you have to write? Let me take one more example. Okay, see example number 2 here. On second example, please see. What is the cause of death? There is a person who is suddenly dead. Why the person is dead? There is the internal bleeding in the abdomen, intraperitoneal bleeding. So the cause of the death is intraperitoneal bleeding. Some major vessel, it is bleeding inside and the complete peritoneum is filled with blood. And it is an emergency. The person is dead because of that. Severe bleeding. Person go in shock and dead. All the blood, 5 liters of blood, it's bleeding in the abdomen, internal bleeding. Now, why a person should have internal bleeding? Because the person was having a metastatic deposit in the liver that got ruptured. And from that, the person was bleeding. Why the person have metastatic deposit in the liver? Person was having a metastatic deposit in the liver that got ruptured. And the person was having colon cancer. Because of the colon cancer, the mats were there in the liver. They got ruptured and it got bleeding. See a pura story suno. Person have colon cancer. Because of which the liver have mats. Because of which the one of the mat get ruptured. And because of which the person have intraperitoneal bleeding. And that is the cause of the death. So you tell me what is the essence here? The main disease is the colon cancer. So here the main disease was diabetes. Here the main disease is colon cancer. So line 1C or 1D. 1C or 1D represent the main disease. Got it? Got it. 1D is not compulsory every time. But 1C you have to fill. Everyone got it? So you get one question on that, which is the essence of death certificate. You have to mark 1C or 1D. Essence matlab main disease. The main disease is on 1C or 1D. And what does line 2 represent? Other diseases. Whatever other diseases the person have. So that is the example. Got it? Everyone got it? So this is related to death certificate. There are 4 or 5 lines. The essence of the disease is 1C or 1D. Please learn that. The essence of the disease is 1C or 1D. Okay, and line 2 represent other diseases also, which are not related to the cause of death. How many of you got it? I want thumbs up. This is international death certificate. Okay, now someone is asking regarding SMR is a ratio or rate. It's a ratio. You can remove 100. Sometimes we include 100 to do the multiplication, but you remove the 100. It's a ratio. Numerator, denominator are not related to each other. Got it? This is a ratio. Can we go ahead now? Okay, can we go ahead? Please everyone say yes if you got it. Everyone, this is the international death certificate. How many lines you have total and which is the essence? What you have to fill on each line. So you get 2 questions. Which line contain the acute cause of death? And which line contain the antecedent disease, the main disease who leads to the death, because of which the person is dead. So acute cause of death is on 1A and the main disease who is leading to the death is 1C or 1D. So both are different questions. You have to give two different answers. Please read your question very nicely. Got it? So read the question and tell me the answer. This is death certificate. In WHO recommended death certificate, the main underlying cause of the death is recorded on which line? 1A, 1B, this is 1C. By mistake, it's typing mistake. 1C or 2. What is the correct answer? I'm saying the main underlying cause. I'm not saying acutely the person is dying because of which. Hana, main underlying cause. So main underlying disease is 1C. The main disease. Hana, diabetes was there and colon cancer was there. So main disease which is leading to the death is on 1C. So 1C is the line. Oh, 1C is the line. Hana, answer is wrong. This is 1C. Hana. So please understand the two questions. Do you have any confusion here? Please ask if you have the confusion. So 1C is the correct answer. Can we go ahead? We are done with measures of mortality. Now it's time to start morbidity. Mortality is complete. So in mortality, what I taught you, the measures of mortality, we have seen the 6 indicators: TDR, SDR, PMR, survival rate, case fatality rate, and SMR. Okay, you know the formula of each of them. You know whether it is a rate, ratio, or proportion, and you know the one-liner significance of each of them. There is no doubt in that. But whenever there is a mortality, we always talk about the death certificate. Because you should know how to make the death certificate whenever someone is dead. So I talk about the death certificate, how many lines are there, which is the main line which represent the main underlying disease. Answer is 1C or 1D. Repeated ask question. This is international death certificate given by the WHO. We are done with mortality. Time to start morbidity. Time to start morbidity. I guess everyone is with me. So we must start morbidity now. Can I start morbidity? Say yes. Can I start morbidity? What is morbidity? Morbidity is disease, not death. I want to measure the disease now. I have already measured the death in the country. Now in the country or in the geographical area, I want to measure the disease now. Let's say a country. Let's say a geographical area. Again, I will say India. Let's take the timeline. I always take the example of 2022. By 2022, I always mean from 1st January to 31st December. Please imagine. Whenever I say 2022, you imagine the first day and the last day. उसके बीच की बात कर रहे हैं. Okay, now let's take a disease. We are not talking about death. We are talking about disease. So we have to take an example of disease. Let's take any disease. Which disease? TB. कोई भी ले लो. You can take any disease. ठीक है, TB. So what is the morbidity of TB in India in 2022? How you will measure? How you will measure? Let's take any disease. XYZ, any disease. So whatever you are disease taking in India in 1 year, what is the morbidity of that disease? How you will measure? How you will measure? Are there indicators? You will say, yes, ma'am. We can take the cases from 1st January to 31st December. How many cases of the TB are there in the country upon mid-year population in 2000? We can do like that. So you are taking only new cases. So see, we are having two indices here. We are having incidence and prevalence. Morbidity measure करने के लिए we have only two indicators. We don't have 6 indicators like mortality here. We have only 2 indicators, incidence and prevalence. These are the 2 indicators to measure the morbidity. Mortality, we have 6 indicators. Here we have only 2 indicators. Please understand the difference between incidence and prevalence. Please, everyone here. So let me tell you the difference between incidence and prevalence. Please understand, very, very important. The denominator of both of them is mid-year population. Don't write mid-year population. You say population at risk. The population which is at risk, by risk means it is mid-year population only, but which is non-vaccinated. I'm removing the vaccinated one because vaccinated one will not have the disease from the total population. So just remove that. उनको तो होगा ही नहीं disease, the person who are immune. Population at risk means they are non-immune, they are susceptible, they can have the disease. Just suppose I am vaccinated for BCG, तो मुझे TB नहीं होगा ना. So why you include me in the denominator? Anyone for any particular disease we are talking. Got it? So population at risk, we take the denominator instead of mid-year population. Both are equally same. You can take mid-year also. Mid-year population may say I'm deducing the one who are immune. I'm taking only susceptible one. It's so sometimes you get the population at risk, sometimes you don't get population. So I will consider mid-year population the complete population at risk. So both are equivalent. Depending from situation to situation, we can change the denominator. Though both are almost same. Mid-year population is total population. From that, I'm deducing the immune population which is already vaccinated. So actually, the disease will occur only at risk population. Puri mid-year population ko nahi ho sakta. Right? Now, out of them, see the numerator. If I take only new cases in 1 year, so it is incidence. And if I am taking total cases, total means new plus old both. New plus old, I will explain. Old both, it will be prevalence. So in incidence, we take only new cases. In prevalence, we take both cases. One more difference. In incidence, the multiplier is 100. I'm sorry. The incidence, the multiplier is 1000. And in prevalence, the multiplier is 100. So I can say this is 1000, this is 100. In both of them, the numerator, okay, let's take a year. कौन सा year की बात कर रहे हैं? 2022. Because it is already completed. 2023 is running, I cannot take that. So 2021 also we can take. The year which is already completed. Imagine the first day of the year, 1st January. Imagine the last day, New Year party we do, 31st December. Okay, so in this year, the new cases of the TB, if I take, only new cases, है ना? New cases जो पहली बार diagnose हुए, that is my numerator. That is known as incidence. But maybe कुछ cases पिछले चले आ रहे हो. There is a case who is having TB in 2018 and till now it is not treated, continuing. So if I am including old as well as new, it will be prevalence. Say yes if you got it. Say yes if you got the meaning. Got it? So here the numerator is a part of denominator. The new cases are from population only. And here also the numerator is a part of denominator. The total cases, the new and old, are from population only. They are not aliens. So in both of them, the numerator is a part of denominator, but here multiplier is 1000, here multiplier is 100. So incidence is a rate and prevalence is a proportion. And a P for P, you will not forget P for P. Okay, how many of you got it? How many of you got it? So this is the formula of both incidence, prevalence. So the main thing you have to learn, incidence include only new cases and prevalence include all cases, current cases, new plus old. How many of you got it? Learn that. Denominator is mid-year population or population at risk. It's one and the same thing almost. But multiplier, you have to concentrate. Incidence makes 1000 and proportion prevalence makes 100. So incidence is a rate and prevalence is a proportion. You all can understand. Okay. Okay, what you are asking, ma'am, old cases or the population who are at risk means who are not affected. What you are asking, Aditi, I didn't got your question. Can you please elaborate? You are asking on old cases or you are asking for population at risk? Population at risk means the susceptible population which is non-immune. Or if you are getting confused, just remove population at risk, take mid-year population. It's one and the same. Just for extra knowledge I taught you. If you're getting confused, just say mid-year population. That's one and the same. Almost one and the same. So you can take mid-year population only in the denominator. Okay. If you're getting confused for population at risk, it's almost same. And regarding the old cases you are asking, old cases, someone have TB and continuing till date not getting treated. If I'm taking 2022, so usse pehle 2021, 2020, 2019, 2000, someone having TB and getting continued every year. And in 2022 also they have TB, but they are not the new cases. They are the old cases which are running. So they have the TB before 1st January, but they are continuing till date. Okay, so that is the meaning of the old case. Got my point? So both the queries I have solved. Can I go ahead? Can I go ahead? Okay, so see what is incidence. Incidence, the denominator I told you, it's population at risk or mid-year population, one and the same. Okay, the numerator is the new cases and the multiplier is 1000. That's why it's a rate. It's a rate. Hai? So that's why it's a rate. I already taught you. Okay, I will explain this diagram. Wait. Okay, this is incidence. Okay, and prevalence, I told you, denominator is total population. You can say either it's a mid-year population or population at risk, one and the same. But the numerator is the current cases, old plus new both, not only new. And the multiplier is 100. Hana? That's why it's a proportion. That's why it's a proportion. Got it? Say yes, say no, say something. Okay. So you got it. What is incidence? You got what is prevalence. Say yes. Incidence include only new cases and prevalence include all cases. New plus old. That is the main difference between them. Okay. Now, if I want to control a disease, what is control? Yesterday I taught you what is disease control. Control, elimination, eradication. I taught you 3 terms. Control means I want to reduce the disease incidence or prevalence at such a point that there is no more a public health problem. The agent is present in the environment. It can go in the host also, but at a low level. I told you yesterday control. So if I want to control a disease, what should I do? I should reduce the incidence or prevalence. If I want to, just suppose I'm an investigator, there are many TB cases in India nowadays. So I want to control TB. I want to control diabetes. I want to control any disease. What should? The cases which are already occurred, I cannot change them. But the new cases I can prevent by getting better lifestyle, by getting preventive medicine or by getting anything. है ना? So I can prevent the new. I cannot change. Na past हम बदल नहीं सकते. We cannot change the past, but we can change the future. So I can control the new cases. I cannot work on the old. Since I cannot change the old, I cannot change the prevalence. But I can change the incidence. So control of the disease incidence is useful. If we reduce the incidence, the control, disease automatically become control. Got it? We have to reduce the incidence. So control is related to incidence. Got it? The control is related to incidence. How many of you got it? Anna. So for control of disease, look at incidence, not prevalence. Okay, this is the use of incidence. ठीक है जी. And the funds are also sanctioned according to incidence of a disease. For example, there is health ministry. We all have health ministry. You know our health minister. So there are many programs running in the country. है ना? TB program, blindness program, ये program, वो program. So where is the funding? Who does the funding for that? Everything requires money, funding. है ना? So funding is done by the central government, health ministry, health government. What? So which program receive how much of the funding? How much you will give to the TB program? How much crores? How many lakhs? How much you will give to the blindness? So that depends of the incidence of all these diseases in the country. The disease having higher incidence require more control, so funding should be more. So in that proportion only we do the funding and everything. So all the health programs run based on the incidence. So that is one more use. Got it? Say yes. What is the use of the prevalence? Imagine I'm a businessman. I'm a businesswoman. Okay, I want to open a hospital. I'm not a doctor. Imagine. Okay, I want to open a hospital. I want to do business. I want to hire doctors. Okay, I want to hire many doctors. Okay, so just suppose I want to open a TB hospital. Okay, this is my hospital. So how many doctors I should hire? How many bedded hospitals should I make? How many bedded hospital? How many nurses should be there? What is the staff? So who will decide that? It is not our wish कि हम कोई भी कितना भी खोल लें. It is not that. You have to take the permission. Like I want to open a 100-bedded hospital, 1,000-bedded hospital. Based on what? Hana? So in which area you are opening, you have to see the prevalence of that disease. Hana? So in your hospital, it is not the thing only new cases will get the admission. Old cases will also come in your hospital. So you will entertain both the cases. Okay, ji, both the cases, the old as well as new. So based on the prevalence, you will decide how many bedded hospital, how many doctors, how many staff you will take the permission from the committee. Say yes or no. So for hospital administration, you will look at prevalence, not at incidence. But for control of disease, you will look at incidence. If you understood, it's good. Just for your knowledge, I'm telling you the details. Otherwise, you know what other educators do. Incidence for control and prevalence for hospital administration. Learn one word. That's it. But for your knowledge, I'm telling you, don't mug up the things. Understand? If you're opening a hospital, it is not the thing. No, only new cases will take the admission. तुम ऐसा थोड़ी बोलेगे, भाई only new case आना मेरे hospital में, old case TB है तो हम admission नहीं देंगे. No, everyone is entertained. Any patient can come. Okay, but if you want to control a disease, you cannot change the old case. You cannot go in the past and change the old case. I know we don't have time machine. Okay, we will change the new case. We can prevent the new case to occur. So control is related to incidence, but the hospital administration related to the prevalence. How many of you got it? So please learn one use of that. That's it. Incidence to control the disease. Prevalence for hospital administration. Are we done? Are we done? So that is the thing. Now let me explain you this diagram. Beautiful diagram. The diagram I have not made it. I have taken it from a great author, Park. And in that book it is given. You can understand. See the imagination. Okay. Can you see the tap, the new water which is coming, the new water which is coming? Can I say this is incidence because it is new? And after going, it is mixing with the old. So old and new both got mixed here. Old plus new both got mixed here. So can I say it is prevalence? So the new water which is falling is incidence, and the total in the container total, the new is coming and old is already there. So old and new mixed together. So can I say this one is prevalence? A way of teaching, a way of understanding. Got it? So can you see in this diagram, they can come, they can ask you the labeling. What is incidence? You can measure, mark this. What is prevalence? You can mark this. The total container water is prevalence. But whatever new that is falling from the tap every time. So you can imagine the TB cases come every time. Every time. We are talking every second a new case of TB is coming. Hana? So that is incidence. And it is mixing with the old one. So that will become the prevalence. Right? What is the exit? Exit is two. Either the person will recover or die. Hana? If someone is having a disease, there are only two outcomes. If the person is taking treatment, good treatment is available, prognosis is good, the person will recover. And if the treatment is not available, patient is not taking the treatment, the person will die. So outcome is only two, either recovery or death, the two extremes. Say yes. So basically this diagram can come for labeling. They can ask you to fill in the blanks at the three places. You know what to fill. Now you can understand. I mean, the new water which is coming is incidence. The total water in the container, the new plus old, is the prevalence, and the exit point is recovery or death. I can frame 10 questions on this diagram in front of you. Anna, I can ask you to fill in the blanks, to label, to anything. Okay, Ji? Can we go ahead? Just understand the diagram. That's it. Okay. So I told you, let me summarize. Let me summarize and we will solve some numericals then. Incidence, prevalence. Can you people help me, please? What is incidence? What is prevalence? You have to tell me the numerator and denominator of both of them, the multiplier of both of them, and the use, one use or two uses of both of them. Okay, and tell me whether it is a rate, ratio, proportion. Tell me which tool among the tool, rate, ratio, or proportion. Okay, tell me. You have to do that. Fill in the blanks. Karo, fatafat. What is the denominator? First comment on the denominator. The denominator, better to say population at risk instead of mid-year population. But if population at risk is not given, I will consider mid-year population only. Okay, that is the denominator. What is the numerator? Here the numerator is only new cases. Among the population, how many new cases are there in 1 year? Here among the total population, I will take all cases. By all, I mean new plus old both. Okay, and that's about the multiplier. Here the multiplier is 1000, that's why it's a rate, and here the multiplier is 100, that's why it's a proportion. In both of them, the numerator is a part of denominator. Okay, Ji, got it? Hannah, the use. Here the use is, what is the use here? What is the use here? The use is to control the disease. And what is the use here? The hospital administration. Hospital administration. Along with the control, the National Health Program of funding also will occur like this. I told you based on the incidence. So these are the uses you can learn. That's it. Okay. So we will see. You have learned this diagram also. You can see. For the incidence, we see the control of the disease. And prevalence ka use mein, you can see for administrative purpose, the planning purpose, the hospital management, hospital beds. In sub mein we require the prevalence. Okay. Now we will solve a question. We will solve a question. The question is in front of you. I will ask 4 questions. Please, everyone on the screen, concentrate. I will ask 4 questions, 4 answers. First, understand. Hana? First, understand. Don't mug up. Just understand what I'm asking, what I'm saying. So listen, this is graph or figure shown to you of 2022. It's already passed. Hana? This is the 1st January 2022. Imagine the day. Hana? The new year started. Okay, and imagine the day that year completed. We all have done the new year party on this day. Okay, so 31st December, it's 2022, it's already passed. Okay, you can see, you will see, okay ma'am, understood the 2 lines, the meaning of the 2 lines. Please understand, this is 1st January, this is 31st December. Now there are 8 cases shown to you. See, I'm telling you the story of all the cases one by one. There are 8 cases. See, case number 1. Let me tell you the story of case number 1. Case number 1 was diagnosed before the January of 2022. It's an old case. Maybe 2021 it is diagnosed, and it is continuing throughout the year, not treating, and till 31st December also it's not treating, and it is continuing in 2023, which is running right now. And here is the end point. Now I don't know end point. End point can be recovery, can be death. I don't know whether the person is dying or recovering, but this is the end point. The end point is recovery or death. I don't know. I will not comment the person is dying or person got recovered, but the disease is not there. I can see the line terminated. The line is terminated. That is the story of case 1. Now you can make the story of all. This is the story of case 1 I taught you. What is the story of case 2? You will say, ma'am, case 2 also started with case 1 before 2022. In 2021 December, maybe just before the start of 2022, we can see it starting, and immediately in January, February only it got terminated. Again, we don't know the reason for termination. It can be recovery, it can be death, but it's a short line. So see the story of case 3, when it is starting, when it is terminating. See the story of case 4, case 5, case 6, case 7, case 8, but see the 2 lines. Whether the case is coming before that, between that, after that, you can understand. So you can see the circle is the starting point and this is the end point. You can understand. How many of you got this diagram? You have to understand the story of 8 cases. I want to ask you a few questions here. How many of you got it? How many of you got it, people? How many of you got it? So tell me the answer. The first question, tell me the incidence of this disease. In the incidence, how many cases you will include? Out of 1, 2, 3, 4, 5, 6, 7, 8. In the incidence of 2022, how many you will include? What is incidence? Incidence is only new cases, not the old ones. So tell me which one are new. So new means which are diagnosed after 1st January and before 31st December. That I will consider new cases in this time period. So tell me the new cases only. Which? So Aditi is saying 3, 4, 5, 8. What about others? Tirupati is also saying 3, 4, 5, 8. So don't copy each other. Don't copy people. Which one? Sasika is saying only 4. 4 cases or 4? You have to tell the numbers also. Which 4? Which 4? You have to tell the numbers out of the 8. See the story of all of them. Okay. So, okay, let me come. You all are right. The answer is 3, 4, 5, 8. Listen, case number 1 is diagnosed before. I will not include a new. Case 2 is also diagnosed before. I will not include. But case 3 I will consider. Case 4 I will consider. Case 5 I will consider. Case 6 again I will not consider. It is diagnosed after this time period. I will not consider. Case 7 also I will not consider. It is before. And case 8 I will consider. So I will consider 3, 4, 5 and 8. So my answer is 3, 4, 5 and 8. These are the new cases which are after 1st January and before 31st December. These are the new cases. Not before 1st January, not after 31st December. Between this time zone, kitne new cases hain? That is my incidence. I guess everyone got it. My answer is 3, 4, 5, 8. Huh? Everyone? Let me ask question number 2. I want to ask 4 questions. Abhi to ek hi hua hai. 3 more you have to answer. Okay. So let me ask 3 more questions. Can I ask 3 more questions? Are you people ready? Let me erase it, everything. So you have a clearance. Let me make a clearance. Okay. Okay. Okay, ji. My second question in front of you. Tell me the prevalence on 1st January. 1st January pe prevalence batao. Where is the line of 1st January? Tell me. What is prevalence total cases? Total cases on 1st January. I'm not asking an entire year. I'm asking only on 1st January. Tell me 1st January. Where is 1st January? Ye raha 1st January ka line. 1st January ka line ye raha. Tell me total cases. Old hai, new hai, doesn't matter. Tell me total cases on this day, not in a year. I'm asking in one day. I'm asking in one day. I'm asking in one day. Yes, what is the correct answer? So there are this is a line touching, this is a line touching here, this is a line. So I can see case number 1, this is 1, this is 2, and this is 7. Hana? So this is old or new, doesn't matter. On 1st January, we are having 3 cases. So my answer is 1 to 7. 1 to 7, and you all are right. My answer is 1 to 7. Got it? Got it. Now next question, tell me the prevalence on 31st December. You got my question. 31st December, then for one day, tell me what is the prevalence, not the complete year. On this day, this is 31st December. Whether old or new, you don't bother. Tell me total cases. I'm asking the prevalence. So how many lines are touching here? Case number 1, 3, 5, and 8. I guess 1, 3, 5, 8 will be the answer in that case. How many of you got it? Huh? See the lines which are touching. Okay, ji. Okay, ji. So prevalence on 1st January, you can see these 3 lines. Prevalence on 31st December, you can see these 4 lines. See the lines touching on that particular day. Now tell me the last question. The prevalence in 1 year. Oh, it's gone. Okay, it's there. Prevalence in complete 1 year from 1st January to 31st December. From 1st January to 31st December, complete prevalence. I'm not asking on one day. I'm asking in complete year. So tell me whether old or new, you have to include all. Now, please be very attentive. Huh? What is the correct answer? What you are saying? Prabingal, I didn't got it. Elizabeth, absolutely right. And who is here first to say? Aditi, absolutely right. And after that, other people are also right. Everyone is right. So tell me all the old and new cases in 1 year. So you can say, ma'am, case number 1 is included. It is previous old one. Case number 2 is also old one. 3 is a new one. 4 is a new one. 5 is a new one. 7 is an old one. 8 is a new one. But 6 is not included. It is out. It is out. It is neither new nor old. It is not coming in this time zone. So except 6, everything is there. So I will say 1, 2, 3, 4, 5, 6, 9, 7, and 8. This is my answer. And you all are right. You all are right. Very good. Very good. Can we go ahead? Can we go ahead? So this is how you get the questions. Simple questions. They can frame many questions based on this concept. So just learn the summary. Incidence means new and prevalence means old. Old plus new both. That is total. That's it. As simple as that. So can we go ahead? What's the relationship between prevalence and incidence? How many of you got it? Anyone have any trouble in this diagram? Can I move? So 4 questions and 4 answers are given to you. What is incidence? What is prevalence on 1st January? What is prevalence on 31st December? And what is the prevalence in total 1 year? So incidence is always 1. But prevalence I can ask you at a point also, in a period also. Okay, ji, everyone got it? Read the question. Don't mug up. I have seen the student mugging up the numbers. Come on. They will change one line. Everything will change. Don't mug up. Understand what they are asking. They are asking incidence. Look for the new cases. And they are asking for prevalence. Look for the total cases. As simple as that. Okay. Okay. Can we go ahead? What is the relationship between incidence and prevalence? Please learn a formula. Prevalence is equal to incidence into duration of the disease. है ना? So incidence is the new disease. Usme if you add the duration, it will become prevalence. So prevalence is equal to incidence into duration of the disease. Please learn a formula. So what is the formula? Prevalence is equal to incidence into duration of the disease. Everyone got it? In this formula, can you see prevalence is depending on 2 factors? Prevalence is directly proportional to incidence and prevalence is directly proportional to duration. Everyone can see that. है ना? More is the incidence, more is the prevalence. More is the duration of the disease, more is the prevalence. Can I say that? Can I say? How many of you got it? So let's talk about duration. Prevalence is equal to incidence into duration. Okay, let's talk about duration. Okay? There are 2 possibilities. There are some diseases in which duration is very high. For example, TB. Let's take an example of TB. Okay. TB, the duration is very high. Once the TB occur, minimum 6-8 months to hota hi hai, 1 year to lagta hi hai treatment mein. So duration is very high once it occur. But tonsillitis, the duration is very less. है ना? It occurs and it resides and subsides in 5 to 10 days, 7 days. है ना? But in TB, duration is very high. है ना? So the diseases which have high duration will have more prevalence. Can I say the reason? Because duration is high. TB have high prevalence. It is not ki incidence is more. It is ki duration is more. Got my point? Say yes. Say yes. Incidence से अभी मेरा मतलब नहीं है. Got it? There are certain diseases in which duration is less. Tell me the reason of less duration. Less duration का reason क्या हो सकता है? There can be two type of diseases here. The diseases which are having a good prognosis and they are treated very early, like tonsillitis. है ना? Tonsillitis में duration बहुत short है. And the diseases which are fatal, जिनका कोई treatment ही नहीं है, like rabies, 5 days में death हो जाती है. उनका भी तो ड्यूरेशन शॉर्ट है ना. सो शॉर्ट ड्यूरेशन से मेरा मतलब ये नहीं है कि वो ठीक हो गया, वो मर गया, ये भी शॉर्ट है. Got my point? What I mean to say. So short means recovery also and short means death also. So there are two type of. So we have less prevalence of rabies because the duration is short because the disease is fatal. Patient dies. We have less prevalence of tonsillitis because the duration is short because patient don't dies but get recovered. You are getting my point? So short duration mein we have two options. We have two options. Either the patient is recovering in a short duration or patient is dying in short duration. Either the disease is too good, get recovered very, very fast, or the disease is too bad, too fatal. Within 4 or 5 days, death occurs. Say, got it? Huh? So that is the thing you have to take care. And fatality, we forget. We forget fatality. Because of fatality, also the prevalence can reduce. Hana? So all these diseases which are very fatal, the prevalence is less because the duration of those diseases is less. How many of you got it? Say, respond. Hana? One more thing you have to learn. Let me ask you two questions. Let me ask you one by one. Okay. What is the effect of treatment on prevalence? If you are giving the treatment, the prevalence will increase or decrease? My question. Prevalence will increase by giving treatment or decrease? With reason you have to tell me. Write down the formula. Prevalence depends on two things: incidence and duration. So what does the treatment affect? Treatment क्या affect करेगा? Treatment affect incidence or treatment affect duration? So that based on that only you can change the prevalence. First tell me why. Why? So this Leah is saying decrease, Shivangi is also saying decrease. Other people are quiet, they are not saying anything. People say, don't, if you be quiet now, you will be quiet in the exam also. Try to speak up. Whatever you think like, it's okay. I'm giving you the clue now. Tell me the effect of treatment on prevalence. This is the formula of prevalence in front of you. Prevalence will get affected only if incidence or duration get affected. So one of them should be affected by treatment. So first tell me, treatment affect the incidence. Incidence मतलब new case, वो तो हो चुका ना. You cannot change the incidence with the help of treatment. The disease is already there. It's already there. You cannot change the new cases with the help of treatment. But yeah, duration of the disease can be altered because of treatment. So treatment have no effect on incidence. हटाओ, है ना? Incidence पे इसका कोई effect नहीं है. But yeah, definitely treatment have the effect on the duration of the disease. Right? Right? Okay. So most of the people are saying decrease, decrease, है ना? Because the treatment will decrease the duration. Shivangi is saying effect on duration. Duration will decrease. Everyone thinks like that only. Everyone thinks. My answer is prevalence will increase and decrease both because treatment increases the duration as well as decreases the duration. You will say, ma'am, decrease तो ठीक है, treatment लेने से duration of the disease कम होता है. कभी ऐसा सुना है treatment लेने से duration of disease बढ़ता है? Yes, it happens. It happens. So there are two type of diseases in the world. Diseases in the world are of two type. Some diseases are curable, for which the treatment is available. Straightforward, take the treatment, disease will get cured. है ना? For example, tonsillitis, TB, you take the treatment, disease will get cured. है ना? There are some non-curable disease. These are known as chronic disease. What they are known as? Chronic. Once they occur, there is no treatment available. Like diabetes, एक बार हुआ till death it will be there. It is not curable. Hypertension, once it occurred till death it will be there. है ना? Many people are diabetic, hypertension, the two most common chronic diseases in our world. Everyone have diabetic and hypertensive patient in your home. Maybe the parents, grandparents, relatives, some. It's very common. Okay, but they are not treatable. Once they occur, they will occur for always. You cannot cure them. What you can do, you can control them, but you cannot cure them. How we can do the control? For diabetes, we have insulin, anti-diabetic drugs, oral hypoglycemic drugs. For hypertension, we have antihypertensive, beta blockers, multiple drugs are there, with which we are controlling the disease. है ना? The day patient take the medication, the disease is controlled. The day patient don't take the medication, again disease will come. It is non-curable. है ना? Curable में once the treatment course is over for 7 days, 10 days, few months, after that patient don't have to take the treatment throughout the life. But for diabetes and hypertension, patient takes the treatment throughout the life till death because disease is forever. Got my point? So here by giving treatment, we are reducing the duration of the disease. है ना? We give the treatment, tonsillitis I have, है ना? I'm having typhoid, है ना? I take the treatment, duration will reduce. ठीक है? So here by giving the treatment, we are reducing the prevalence because we are reducing the duration of the disease. That's why prevalence get reduced. Prevalence is directly proportional to duration. But here we give the treatment. है ना? We give the treatment to diabetic person. We give the treatment to hypertensive. What we are doing by giving the treatment? We are increasing the duration of diseased people on this earth. है ना? If we don't give treatment to them, they will die. है ना? Eventually, the diabetic will have diabetic nephropathy, retinopathy. They will die. Hypertensive also will have hemorrhages here and there. They will die. But we do not want them to die. So we cannot treat them, but we will control it and keep going. कि जितना धकेल दो, keep going. So we are controlling the disease, not curing it. So basically here in these diseases, if I'm giving the duration, if I'm giving the treatment, I'm increasing the duration of the diseased people on the earth. If I don't give the treatment, they will die and the prevalence will reduce. But we don't want them to die, of course. I know. So here we are increasing the duration of the diseased people on earth by giving treatment. So basically we are increasing the prevalence of diabetic and hypertensive people on the earth. So my answer is both. The treatment can increase as well as decrease the prevalence. You got it? How many of you got it? How many of you got it? For curable disease, we are decreasing the prevalence. For non-curable chronic disease, we are increasing the prevalence by giving treatment. है ना? We are treating these also, we are treating these also. Here by giving treatment, we are reducing the disease, duration of the disease because disease will get recovered fast. And here by giving treatment, we are increasing their lifespan. The lifespan of diseased people, they will be always diseased. We are increasing the lifespan of diseased people on this earth. So morally, of course, we will do that. Okay, so we are increasing the prevalence of the disease intentionally in that chronic diseases. So what is the answer? What is your answer now? Let me ask the same question again. Effect of treatment on prevalence. Tell me the effect of treatment on prevalence of disease. Will it increase or decrease or both? The three options: increase, decrease, or both. What is your answer now? Everyone right? So my answer is both. It can increase also, it can decrease also, depending what is the disease. Is it curable disease or chronic disease? If it is curable disease, my answer is decrease. And if it is a chronic disease, my answer is increase the prevalence. Okay, increase and decrease both. Got it? Everyone got it? So you get questions on that. Everything is conceptual. If you don't understand, you cannot mug it up. Very conceptual thing. Okay, let me ask you one last question. Formula is in front of you. Prevalence is equal to incidence into duration. Formula will not change. Now I asked you, what is the effect of treatment on prevalence? Tell me the effect of vaccine on prevalence. Vaccine or immunization, one and the same thing, on prevalence, not treatment. I'm asking the effect of vaccine on prevalence. So prevalence depends on two things. What two things? Incidence or duration. Vaccine affect what? Vaccine affect incidence of the disease or duration of the disease. By giving vaccine, what you are affecting? Vaccine matlab kya? It's a preventive thing. We are reducing the chances the disease will occur. I'm vaccinated for polio. I will not have polio. So I have reduced the chances of its new case to occur. So vaccine affect incidence, not the duration. So vaccine always reduces the incidence. And that's why vaccine always reduces the prevalence. Okay, yes, it affects incidence. You are right. And what is the effect? Is it incidence or is it increase or decrease? Vaccine reduces incidence. And that's why it reduces prevalence also. So by giving vaccine, we are reducing the incidence as well as prevalence. Got it? So tell me the two questions to answer. What is the effect of treatment on prevalence? What is the effect of vaccine or immunization on prevalence? So here the effect is very simple. The treatment can increase as well as decrease the prevalence depending what is the disease. And here it always reduces the prevalence by reducing incidence. Okay, so this is the summary in front of you. I guess everyone got it. If you got it, it's good. If you didn't got it, learn this. So this is the thing. So we can make it out with the help of formula. What is the formula? The formula is prevalence is equal to incidence into duration. So based on this formula, we commented on two things: the effect of treatment on prevalence and the effect of vaccine on prevalence. Treatment affect duration, vaccine affect incidence. Based on that, we commented. I guess everyone got it. Everyone. So same thing is written in front of you. If there is a curative disease, the disease is curable, so prevalence will decrease on giving treatment because the disease will recover fast. But if there is a chronic disease, non-curable disease like diabetes, hypertension, so here by giving treatment, you are increasing the chances the person's survival on the earth. The diseased person survival on earth, not healthy person. He's a diseased person. So we are increasing the prevalence. So this is the effect of treatment done. Okay. And for vaccine always work on incidence. It reduces the incidence, that's why reduces the prevalence. I hope you are got, Hannah, we are got. Okay, so we have seen incidence, we have seen prevalence, we are done. Incidence is a rate, prevalence is a proportion. Incidence is new cases, prevalence is old plus new cases. This is for control of disease, this is for administrative purpose, hospital administration and planning purpose. That's it, Hannah. We have seen the relationship also, we have seen the formula also. Anyone having any doubt? Can we solve some numericals now? Read the question, tell me the answer fast. Read the question, tell me the answer. Can you please read the question? Just a second, I have to open the Telegram chat. Okay, where is the group gone? Okay, it's here. Okay, yes, so let me read the question. The following is true about the prevalence and the incidence. Both are rate. Is it true? No. Prevalence is a rate, but incidence is not. Incidence is a rate, but prevalence is not, or both are rates. Both are not rates. So this is not true. This is not true. We know incidence is a rate, but prevalence is a proportion. So I will go with C, and everyone is correct. You all are right. Prevalence is a proportion. It's not a rate. So C is correct. Among the option, the correct answer is C. You all can make it out. The next question. Improved prevention of acute non-fatal disease is likely to do what? It will affect prevalence or incidence. First decide that. First decide that. What I am saying? Improved prevention. We are preventing a non-fatal disease. We are preventing a non-fatal disease. We are preventing a non-fatal disease. So we are doing what? We are increasing the prevalence, decreasing the prevalence, increasing the incidence, decreasing the prevalence. Acute non-fatal disease. What you will say? What you will say? We are preventing. We are preventing. So you are right. Correct answer is A and C both. Because we decrease the incidence, so ultimately prevalence will also decrease. But preventing disease होगा ही नहीं, तो incidence कम होगा ना, और incidence कम होगा, तो prevalence भी कम होगा. So A and C both is the correct answer. It's a PGI question. You can say A and C both is the correct. Okay. The next question, a tricky question, very tricky question. A and C both are correct. You both are right. You all are right. I mean, some are saying A, some are saying C. Both are correct. है ना? Because we are preventing a new disease. So incidence we are decreasing, and obviously prevalence also we are decreasing, because incidence is directly proportional to prevalence. Okay. The next question. There is a drug which reduces the mortality of the disease but does not cure the disease. एक ऐसा ड्रग है जो पेशेंट को मरने नहीं दे रहा है लेकिन ठीक भी नहीं कर रहा है, सिर्फ उसको कंट्रोल कर रहा है. The drug is just controlling the disease. It is not curing the disease. It is not treating the disease. Just controlling the disease. It is not curing. So what the drug is doing? Drug is doing what? So here the incidence and prevalence both will increase by giving this drug. Incidence and prevalence both will decrease. Incidence increase or prevalence decrease, or incidence is same, prevalence increases. What do you say? What do you say? Read the question. Read the question thoroughly. Apply the formula. Don't rush. You people just rush and type the answer. Just think it out now. What is the formula? Prevalence is equal to incidence into duration. What I am saying, the drug is doing what? Please read the question again. And you have trouble in understanding the English language? I don't think so. Read the question again. There is a drug which reduces the mortality. Patient mar nahi raha. Patient is not dying. Reduces mortality, but not curing a disease. Matlab kya iska? The patient will remain always disease. I'm talking about diabetes and hypertension. The drugs for that. They do not cure the disease. Hai By taking the drug of diabetes and hypertension, person don't get cured. The drug has to be taken daily till death. Okay, and it is preventing the person from dying. That's it. Hannah. So such drug is increasing the duration of diseased person on the earth. Hannah, such drug is increasing the prevalence. They have no effect on incidence. None of the drug have effect on incidence. Incidence पे effect vaccine का होता है, drug का नहीं होता, है ना? The drug means a treatment. Treatment तो हम disease के बाद देते हैं. Treatment we give after disease. Vaccine we give before disease. So vaccine affect the incidence. Treatment do not affect the incidence. So incidence will be same. But here the prevalence is increased because the duration is increased. So answer is D. Why you people are saying A? I don't know. I don't know. Those all who are saying A as the answer, can you please explain why you are saying A? Why? In prevalence increase, I agree. But why you are saying incidence will also increase? Drug cannot affect on incidence, beta. Incidence means new case. Case तो already हो गया ना, अब treatment देके उसको कैसे बचा लोगे? Just suppose I'm a case, I'm having a disease, for example XYZ TB I'm having, है ना? So I'm already now a case of TB. You are a doctor, you will give me treatment. So treatment cannot prevent the new case in me. It can treat the already existing case. So treatment is effective in already old case, Anna, now you cannot prevent the disease. It's already happened. But if you are giving a vaccine of TB, BCG to me, I will not have disease in the future. So you are reducing the new case. So vaccine is effective for the new cases, that is incidence. And treatment is effective only for prevalence, not for incidence. Got my point? This is the thing. Okay, so D is correct. Everyone got it? Everyone, those who are saying A, are you agree now that D is the correct answer? Say yes. Okay, we will solve some numericals now based on the formula. Read the question. The incidence of disease in a population of 30,000. In a population of 30,000, incidence of a disease in a population of 30,000 and 300 new cases. You have to calculate the incidence. What is the incidence of the disease? The total population is given to you and new cases are given to you. What is the formula? New cases upon mid-year population or population at risk. है ना? Into क्या? Into 1000. Okay, so what is the new case given to you? 300. What is total population? 30,000 into 1000. I guess 1000 cancels 1000 and 10 cancels 10. Answer is 10. Answer is 10. 10 per 1000 is my answer. Everyone got it? Everyone got it? This is how we calculate. Huh? Please see. Got it? Can we go ahead? Yes. So correct answer is not C. It's B. Amrita, it's not C. Do the calculations thoroughly. Now you are doing some zero mistake. Anyone having some other answer? The correct answer is in front of you. Apply. Answer will be 10. It's 10 per 1000. Can we go ahead? The next question is in front of you. Calculate the prevalence. Calculate the prevalence. है ना? Prevalence आपको calculate करना है. If the incidence is 2, incidence is 2 cases per 1000. 2 cases per 1000 population and mean duration is 4 years. The duration is also given to you 4 years. So what is the formula of prevalence? Prevalence is equal to incidence into duration. So it's 2 into 4, that is 8. 8 cases per 1000. As easy as that. Hana, just apply the formula. The answer is in front of you. Absolutely correct. So correct answer is A. You can do the calculations. Hana? So in this way, you can do the calculations. Okay. Okay, you want to do more questions? Read the question, tell me the answer. There is a population of 5,000. The total population, mid-year population is equal to 5,000. Incidence of the disease is 100. Incidence of the disease is 100 in 1 year duration. So time duration, the duration is equal to 1 year. है ना? 1 year of disease studied duration in 1 year duration of the disease studied for 2 years. Okay. So here duration they are asking for 2 years. Incidence is given 100 per 1 year. Now tell me the prevalence. How to calculate the prevalence? Prevalence is equal to incidence into duration. But incidence is given for 1 year and the duration they are asking. What is the correct answer here? How you will calculate? First calculate the incidence. Incidence of the disease here. Incidence here always it should be per 1000. Now first calculate the incidence. Incidence आपको in 1 year duration आपको पहले निकालना पड़ेगा. What is the formula of incidence? Incidence is not directly 100 here. Incidence is the new cases, that is 100 upon mid-year population, है ना, into 1000. So this is how first calculate the incidence. Incidence is 20 and then 20 into 2 will be 40 is the answer. How many of you got it? How many of you got it? The answer will be 40. This is not incidence directly given to you. This is incidence in 1 year for 5,000 population it is given to you. So first calculate the incidence for per 1000. Apply the formula. Okay, read the language. Sometimes language is difficult, but question is not that way difficult. Okay, you all can do that. You all can do that. Okay, can you solve the next question? Very easy. In a population of 5,000, okay, mid-year population is equal to 5,000. The new cases is 500. And the old cases is 150. Old cases is 150. What is the prevalence? Apply the formula, as easy as that. So formula of prevalence is equal to old plus new. So old plus new, 150 plus 500 upon mid-year population, that is 5,000 into 100. The multiplier is 100. Always take care of the multiplier. It will be 650 upon 5,000 into 100. Whatever is the answer. I'm not interested in calculation. I will not do that. But just apply the formula. Anna, take care of the multiplier. Don't take 1000. Okay, take 100 here. And here you have to take old plus new both. Yes, the answer is 13. It's okay. So 650 upon 5,000 into 100. Whatever is the answer. Okay, this is how you have to apply it. Simple question can come. Are we done? Can we go ahead? I want thumbs up from everyone. You are confident for the numericals also? We are done with incidence and prevalence. Can I start the epidemiological studies now? The biggest topic of the day, the epidemiological studies. Can I start epidemiological studies? Till now, from morning, what we have read. From morning, I started my session from rate, ratio, proportion. I told you what is rate. I told you what is ratio. I told you what is proportion. Number one, I told you that. Not only this, I told you the measures of mortality. I told you the 6 measures of mortality. 1, 2, 3, 4, 5, 6. CDR, crude death rate. SDR, specific death rate. PMR, proportional mortality rate. है ना? Survival rate, case fatality rate, and standardized mortality rate. Not only this, at the end of this, I told you the International Death Certificate IDC. The lines on that. The essence is the 1C or 1D, repeated discussion. Not only this, I told you the measures of the morbidity also. Hannah, I told you 2 measures, incidence, prevalence. I told you the differences, their formulas, and I told you a relationship between them. Prevalence is equal to incidence into duration, based on which you get numericals. We have solved the numericals. This is since morning we have done. Hannah, can I move to the 4th topic now? We are done with the tools of epidemiology, indicators of mortality, indicators of morbidity. Till now we are here. Okay, let's start epidemiological studies. Hannah, okay, so let's start epidemiological studies. In the epidemiological studies, we will take 2 types of studies: observational studies, experimental studies. Observational studies, again, of 2 types: descriptive, analytic. What do you mean by all that? Why at all we should perform an epidemiological study? Bhai, karna kyun hai? Why we want to take? Why want to do an epidemiological study? You tell me. Why we want to do epidemiological study? Yes. So let me tell you. Listen. Let me tell you. Listen. Epidemiological study. Just suppose, you know, smoking leads to lung cancer. How many of you know? Smoking leads to lung cancer. I guess everyone knows smoking leads to lung cancer. So smoking is a cause, okay? And lung cancer is the effect of that cause. I will call smoking as a cause, and I will call lung cancer as an effect. So there is a cause which is causing an effect. Hannah? So it has to be proven. Someone has proven that smoking leads to lung cancer. Then only you are believing, no? So how to prove it? There is a step-by-step, someone has to do the study for that, to prove that there is a cause which is leading to effect. For example, if I say you eating a mango leading to blindness, will you believe me? You will say, ma'am, are you mad? I eat mango daily. No, it's not leading to blindness. No, you are wrong. But I believe so. So you will say, ma'am, prove it. If you are sure, you can prove it. Maybe my observation is just in, it can be a coincidence. By chance, I'm feeling like that. I have seen 2-3 patients of blindness, and they are coincidentally they are eating the mangoes, and I correlated the 2 things. Maybe I'm wrong. Maybe I'm right. I'm a new discovery I'm doing. Hannah. So it is not proven. I'm just kidding. Hannah. So you have to prove that. So there is a cause, there is an effect. How to prove that? How to prove that? So I will say, I will take the example of smoking leads to lung cancer throughout my studies. You will say, ma'am, it's already proven. Imagine it's not proven. And today, the first time we are going to prove it. So how someone prove that? Hannah? So first, if anyone wants to prove there is a cause leading to an effect, you have to do descriptive study. If it is in descriptive study, we make a hypothesis. Okay, we test the hypothesis in analytic study. And finally, we do the experimental study. So I am going to teach you 3 studies now, one by one. What are the 3 studies we will do? First, we will do descriptive study. Then we will do analytic study. And then we will do experimental study. Descriptive and analytic are part of observational. How many of you got it? In the sequence only we have to do. First, I will do descriptive study. In descriptive study, I formulate the hypothesis. I will formulate my hypothesis, formulation of the hypothesis. My hypothesis is smoking leads to lung cancer. I will formulate that. Now, I can be right, I can be wrong. My hypothesis can be right, can be wrong. Let's test it. So testing of the hypothesis is done in analytic study. Testing. So we do the testing in analytic. नाम में ही है analysis. We do the testing. Analysis का मतलब क्या होता है? Testing. And finally, in experimental study, we confirm the hypothesis. We have already tested it. Now we will do the confirmation by doing some experiments. So confirming hypothesis. So you get 3 questions here. First, you should know the sequence of the study. What is the sequence? So if you want to, you are a scientist, you are an investigator, you want to prove there is a cause leading to an effect. By cause and effect, I mean smoking leads to lung cancer. So here smoking is a cause leading to an effect, that is lung cancer. So smoking leads to lung cancer, that is my hypothesis. So first, formulation of hypothesis takes place in descriptive study. Then testing of the hypothesis takes place in analytic study. And confirmation of the hypothesis takes place in experimental study. In this sequence we carry out. So one by one, I'm going to teach you 3 studies. How many of you are with me? How many of you are with me? You got it? Say yes, say no, say something. So that is the thing. So if I give you the question, tell me the name of the study in which we formulate the hypothesis. What is your answer? Tell me the name of the study in which we test the hypothesis. tell me the study in which we finally confirm the hypothesis. So tell me the name of the studies. There are 3 studies which we are going to do. So formulation takes place in descriptive study. Testing takes place in analytic. नाम में ही है. Testing का मतलब होता है analysis. So we are analyzing, analysis, analytic study you can say. And confirmation is done in experimental. We will do certain experiments not to just confirm it and final verdict. Before I declare that smoking leads to lung cancer, I have to do the confirmation by doing certain experiments. And then once I have proven now, it will be visible everywhere. It will be published. It will be there on the Google that I have proven that the first time smoking leads to lung cancer. So we can prove that. Anything we can prove. It is already proven, I know. But just suppose I'm the investigator and first time I'm going to prove smoking leads to lung cancer. One by one, I will do the 3 studies in front of you. Okay, let's start with descriptive study. How many of you are with me descriptive study? Okay, so read the question. Okay, the difference between descriptive study and analytic study is what? Descriptive study is used to test the hypothesis. Analytic study is to formulate the hypothesis. Descriptive study is the first phase of epidemiology. Analytic observe the distribution of the disease. What is correct among them? Only one thing is correct. Rest all are wrong. Read the statements and tell me the answer. So first is wrong. Descriptive is not to test the hypothesis. Descriptive is to formulate the hypothesis. Second is also wrong. Analytic is not to formulate. Analytic is to test the hypothesis. Okay. And last one is also wrong. Analytic do not observe the distribution. It's distributive which will observe the distribution, I will tell you. But descriptive is the first phase, that is correct. So I will go with C. I can see the first study is always descriptive, followed by analytic, and followed by experimental. In this sequence only we can go. You cannot jump the sequence. First formulate the hypothesis, then test your hypothesis, and then confirm your hypothesis. So hypothesis, 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 till it is confirmed, I will call it a hypothesis. Once the hypothesis is confirmed, it is no more hypothesis, it is converted into a theory now. So smoking leads to lung cancer, it's a theory. It's already proven. Theory means already proven. Theorem क्या होती है? It's already proven now. We don't have to prove it. There are multiple scientists who have already proven that. So it's a theory. But before that, I will call it hypothesis. Hypothesis can be right or wrong, but theory is always right. So you want to convert your hypothesis into theory, you have to confirm it in the third study. Okay, this is how we go. So you have a sequence. So first descriptive, followed by analytic, followed by experimental. So descriptive and analytic both are observational study. We don't do experiments. But experimental study, we do the experiments. Here we only observe. We don't experiments. Let's start with the descriptive study. Can I start with the descriptive study? You got it? So I'm going to teach you 3 studies now, one by one. The most difficult topic on PSM. Please concentrate. Descriptive study, analytic study, and experimental study. You have to do the studies in sequence, one by one. All 3 studies have to be done. Then only your hypothesis convert into theory. Whatever is your hypothesis should have a cause, should have an effect. Like smoking leads to lung cancer is the best example I find to explain every time. Okay, so here we formulate hypothesis, here we test it, here we confirm it. Let's start with descriptive study, the first study. So I always take this example again and again. I'm saying, I know it's proven, but imagine I'm proving it for first time. So I will call smoking as a cause that will lead to lung cancer. That is my effect. Or else I can call smoking as a risk factor or exposure. So if I say cause, risk factors, exposure, imagine I'm talking about smoking. If I say the effect, if I say the disease, I'm talking about lung cancer. So these are the synonyms. If I use these words now, you just imagine I'm talking about what? So can I say smoking is a risk factor for lung cancer? Yes, lung cancer is a disease. The smoking is a risk factor, or is the exposure. Okay, these are the one and the same thing. How many of you got it? So let's start with the first study. I'm going to teach you 3 studies. Half hour, 15 minutes. So we will take 1 more hour. After that, we will take big lunch break. I'm not going to give you any break. My kid is in the school. I don't require breakfast. So I don't need any break. Once he will be back from the school, I will take a big break for the lunch. Okay. So let's start. Let's continue with the studies. Okay. So let's start it. Let's start with the first one, the descriptive epidemiology. Can I start the descriptive epidemiology? The first one. Okay. So descriptive epidemiology, the first phase of the study. It is the first phase. So here, the descriptive epidemiology, time, place, person. Time, place, person. We describe 3 things here. We describe time, we describe place, we describe person. Okay, time, place, person. Okay, based on that, there is description. Descriptive mein naam nahi hai. Descriptive study is description of the disease. You describe your disease in terms of time, in terms of place, in terms of person. I will explain. And here we will formulate the hypothesis. Then in the next study, we will test it. Here we will not test. We will just formulate in terms of time, place, person. Can I start time, place, person? So descriptive studies in terms of time, place, and person. Okay, descriptive is always the three things. So let's start with time. In time. So in the time, the diseases are of three types. Hana, all the disease you talk about, it will fall in one of the three types. Hana, is your disease showing short-term fluctuation, or your disease show long-term fluctuation, or your disease show periodic fluctuation? What is my example? Smoking leads to lung cancer. This is my example. So my disease is lung cancer. So my lung cancer show long-term fluctuation. लंग कैंसर के एपिडेमिक नहीं आते हैं, इट इज नॉट शॉर्ट टर्म. लंग कैंसर पीरियोडिक भी नहीं होता है कि एवरी विंटर्स इट इज अकरिंग, एवरी समर्स इट इज अकरिंग, इट इज पीरियोडिक, एवरी 2 years it is occurring. No, it's not periodic. It is showing long term fluctuation. Long term means over a trend, है ना. In the last 10 years we have seen the lung cancer cases are increasing drastically because the biggest reason is smoking, of course, है ना. So people are more and more shifting towards smoking, and the biggest reason I blame the media, that like the social media platforms, है ना. The social media platforms or the movies, cinemas, you can say the rock stars, they are shown the smoking and they look very cool when they smoke. Although there is always a disclaimer written that smoking is injurious for the health. Whenever they smoke, there is a disclaimer. Without disclaimer, they cannot show the scene of the smoking itself. But why does it shows? Because you know the teenage is such an age group now which get influenced by these rock stars very easily. You know, the movie stars and the big personalities, the people who is having a big fan following, they should not show these scenes on the big mass communication like the internet or the movies or the series, wherever. They should not show that, Hannah. Because showing that, although you are writing a disclaimer, who is bothering about the disclaimer? You are like with a goggle, they are smoking like this, they look too cool, so teenagers get attracted towards them. And nowadays many people are smoking. We have seen the incidence of the smoking increase drastically. Initially only males used to smoke, nowadays females also started smoking, and the ratio of male and female is almost same. So females are also equally smoking like males only, and the incidence of the lung cancer increases drastically. This is the reason. Anyways, so my point is that the disease lung cancer, it is coming in long-term fluctuation. So in the long term, you have to say over the 10 years, the disease is increasing or decreasing. For lung cancer, my disease will come in this category, and my answer, it is increasing. So I'm concerned currently with my hypothesis. Okay, smoking leads to lung cancer. But there are not always the diseases which show long-term fluctuation. If I say conjunctivitis, you know, nowadays in the India, we have the flu, the conjunctivitis. Now you can see. So here short-term fluctuations are there. Every year, every 2 years, this comes. Sometimes there is a so epidemics occur of many diseases. Short-term fluctuation is epidemic. Long-term fluctuation is secular trend. And periodic fluctuation, every 2-3 years or every season, the disease is coming. So there are three types of diseases. Say yes or no. So you have to say which category your disease is falling. In your hypothesis, you have a disease now. In your hypothesis, you have two things. You have a cause and you have a disease, the effect, the disease. So your disease is showing short-term fluctuation, long-term fluctuation, or periodic fluctuation. One of the fluctuation, definitely your disease will show. All the disease will fall in one of the three category. All the diseases of the world. So whatever is your hypothesis, आपके hypothesis में जो भी disease है, whatever disease it is falling in which category? First say that. Right? We will study all three fluctuations one by one. Can I start? The first one is the short-term fluctuation, that is epidemic. Okay, so you can start with the time. The short-term fluctuation is epidemic. Okay, the short-term fluctuation is known as epidemic. You know what is epidemic? Sudden increase in the cases at any place is epidemic. There are three types of epidemic. Let me tell you. Single source or point source, continuous source or propagated source. Let me explain you the three type of epidemic. Let me explain you. Just a second. So short-term fluctuation, I'm explaining you. The short-term fluctuation is known as epidemic, and there are three type of epidemic. You can see. This is endemic. What is endemic? The cases are constantly present in a population is endemic, but sudden increase of cases in a population is known as epidemic. The epidemics are of three types. Let me explain you the three type of epidemics. The first is single exposure or point exposure. Can I start? Listen, imagine Bhopal gas tragedy. Have you heard about Bhopal gas tragedy? It happens in 1984. What happened in 1984? Have you heard about this tragedy which occurs in India in 1984? In the history, you may have read it or you may have heard about it. So, there was a factory of a pesticide in Bhopal. Bhopal is a city, okay? And there was a poisonous gas leaked from that factory by mistake. There was a poisonous gas. So that the gas get all over the city, it get distributed. People inhale the poisonous gas and have multiple diseases. So although the gas leakage only for few minutes or few seconds, the exposure was brief. The exposure was very brief. The exposure was a point. It was a point source, hardly for few seconds or few minutes. So all the people who are affected in the entire city, they have the disease after that. the complete city have the disease, है ना? All the cases are in one incubation period. In one incubation period, they have the disease. So the graph is like that. Hannah, this is the exposure. The exposure is point here. By point, I mean hardly for few minutes. Okay, the exposure is point. So all the cases have disease together. The peak is there and they all will recover together. So there is only one incubation period. One incubation period. After that, there is no secondary waves. No, it will not occur again. This is point source. This is point source. Example I told you, Bhopal gas tragedy is the best example I imagine here. Or Chernobyl tragedy. Have you heard about Chernobyl tragedy? It also occurs in 1984, but in Ukraine, it's a nucleotide exposure. So instead of the poisonous gas, the nucleotide, nuclear reactive material get exposed in the air, and people get exposed of that, and many people have cancers after that. It's like same Bhopal gas tragedy. Again, the exposure is only for few minutes. But complete population get affected. So a big population get affected in a brief period. So I will call it an explosion. You know the meaning of explosive? Explosion means sudden, a big thing in a short time. Whenever there is a big thing happens in a short duration of time, it is known as explosion occurred. So here can I say explosion of cases are there. In a short duration of time, there is a big number of cases. You can see the entire city is diseased in a fraction of minute. So you can see it's explosive. And there are no secondary waves. All the cases in one incubation period, this is the graph. So in the graph, there is a rapid rise, rapid fall. The rise is rapid because they all have rapidly diseased. And there is a rapid fall. So you can say the graph is rapid rise, rapid fall. How many of you got it? So this is the example. Bhopal gas tragedy I told you. Chernobyl tragedy I told you. Minamata disease in Japan. There was a ship traveling in a sea, and there was leakage of some oily chemicals into the sea. So all the marine life got destroyed after that. Jitne bhi fishes the, aquatic plants, the aquatic life, it got destroyed because of leakage of the poisonous oily material from the ship into the sea. So in the sea, the complete marine life was lost. That was the incidence, again a historical incidence, Minamata disease of Japan. Again, the exposure was only brief. It was point, but you know, all the aquatic life get destroyed after that. Okay, so that is the thing. Can we go ahead? Food poisoning. Imagine a party going on. Everyone is eating in the party, and some of the food is contaminated. Maybe the paneer, the cheese, something is contaminated. Everyone is eating that. After that, everyone have the diarrhea. So the exposure is brief, but after that, everyone who has consumed the food have diarrhea. So food poisoning can also come here in the example. So you can understand the example. So these are the examples I told you. So here it is a type of epidemic. I'm going to teach you 3 type of epidemic, the short-term fluctuation. The first one is single exposure or point source. You can understand the meaning now. Single exposure or point source, the exposure is brief. So single exposure or point source, the main thing, the exposure is brief. The Bhopal gas tragedy, the gas is for few minutes. The Chernobyl tragedy, the radio exposure is only for few minutes. Only for few minutes. It's brief. So that is the thing. All the people are in one incubation period. In the graph, there is rapid rise, rapid fall, and there is explosion. There is no secondary waves. There is clustering of cases in short period. And learn the examples. We are done with the first one. Second is continuous exposure. This was point exposure. Now opposite of that, continuous exposure. Imagine there is a well in a village, which is having contaminated water. The water contains Vibrio cholerae. So everyone is coming, drinking water, having diarrhea, going back. Another people is coming, drinking water, going back. So well is continuously present. It is not only for few minutes it is coming. It is continuously present, always present. People are coming, contaminated, having disease, going back, another. So here rapid rise is there. Rise is rapid, but fall is very gradual. Fall is gradual. There rapid rise, rapid fall. Here rapid rise is there, but fall is gradual. And graph is not complete. You can draw the secondary waves are there. Secondary waves are present. And multiple incubation periods are there. It's not one incubation period. Multiple incubation periods are there. So first example, I told you contaminated well. Second example, you can imagine a prostitute who's a sex worker and she's having some STD. She or he is having some STD. So clients are coming, doing the sexual intercourse, having the disease. Different time, different clients are coming. And every time the clients are coming and having the sexual intercourse with that contaminated person and having the STD, they also have the STD. So the source is always present there. Here also the source is always present. Different time, different people are coming and getting contaminated. Say yes. Got it. So these are the examples you can learn here. Say something. Here the exposure is not point, it's continuous. It's not at the same time, it's continuous. And more than one incubation period are there. There is rapid rise but gradual fall, and secondary waves are present. Secondary waves are present. Examples I taught you. And third is propagated, the last one. No need to explain, it's COVID. Simply, we all have seen what is COVID. You can see this is one case. It is giving infection to 3 others. Now, these 3 others giving to three multiple others. It's a chain reaction, you can say. It's like a chain reaction. You can see the blockers are the immune person. They are blocking the chain. You know the chain reaction. It is person to person transmission, as the name suggests. It's propagated. Propagated का मतलब क्या होता है? Person to person, है ना? So can I say every new case become a source of other? The source is not this one only. So every new case become the source of other. Every new case become the source of other. It's a chain reaction that is propagated, है ना? So here gradual rise, gradual fall. Rise is also gradual, fall is also gradual, and secondary waves are always present. Okay, secondary waves are present, and it depends on the herd immunity. Okay, so example is COVID, hepatitis, polio, that's it. The 3 graphs are in front of you. These are the 3 types of epidemic in front of you. Let's summarize. The 3 type of epidemic in front of you, the short fluctuation. Okay, this one is point exposure. This one is continuous exposure, and this one is propagated. Name indicate. नाम में ही मतलब है. See the name, you can understand the meaning. You can understand the meaning. Point exposure, है ना? Exposure is only brief. Bhopal gas tragedy. Rapid rise, rapid fall. So here rapid rise, rapid fall. Say yes. And there is no secondary wave, and all the cases are in one incubation period. Say yes. In continuous, always remember the example of the well, contaminated well in a village or prostitute. Source is continuously present. है ना? So rapid rise, but gradual fall. And secondary waves are present, and more than one incubation period are there. है ना? And in propagated one, always remember the example of the chain reaction. That is COVID. So there is gradual rise, gradual fall. Secondary waves are present here also, and more than one incubation period. How many of you got it? Say something. React. React. You got the 3 graph? Anyone having any confusion? Learn the examples of all 3 categories. Here I example of Bhopal gas tragedy. Okay, I always give the example of Chernobyl, Minamata disease of the Japan, and food poisoning. Here I give the example of the well and the prostitute, which are constantly present there. And different clients, different people are coming and getting contaminated. Here I give the example of the COVID, hepatitis, polio. Anyone having any example, any problem again? Herd immunity we will take, Karthik, in detail. I'm not explaining immunity here. I'm explaining you the 3 graphs. You got that? You got that? The 3 graphs you got? You got it? Herd immunity is the immunity of the complete community. Anna, you can see the black dots. The black dots are already immune. Either they are vaccinated or they already have the disease in the past. So they are not transmitting the chain. They are not continuing the chain. They are like blockers. They are not continuing the chain. They will not give the disease to the next one. Anna, so all the black dots in the community is the herd immunity. So more is the herd immunity, the disease can be controlled. That is the meaning of the herd immunity. Everyone got it? What is the 3 type of the epidemic? So I taught you the epidemic. The 3 type of the epidemic I taught you. Point exposure, continuous exposure, and propagated exposure. The name itself depicts its meaning. Okay, Hannah? So you tell me in each of them regarding exposure. In the graph, tell me the rise, tell me the fall. Tell me secondary waves present or absent. Tell me incubation period, how many incubation period. Tell me the examples. We will fill. So exposure. First tell me exposure. Here exposure is point. It's brief. Here exposure is continuous. And here it's chain reaction. Every new case is a source of other. I will call it a chain reaction. This is regarding the exposure. Yes. So rise. Here rapid rise. I will say rapid rise and rapid fall. Anna, you imagine the graph. And secondary waves are not present. Secondary waves are absent. And all the cases are in one incubation period. Here, rapid rise. Rise is rapid, but fall is gradual. It's slow, gradual. Hannah? And secondary waves are present. Okay, and more than one incubation period are involved because secondary waves are there. Here, gradual rise, gradual fall. Hannah, secondary waves are present here also. And more than one incubation period is involved here also. And examples I just enumerated. Please write the examples here. This is how you can make a table and you can make the graph. This is the easiest way I can teach you. Okay, we are done. We are done with time. Coming on the place now. I taught you now, I want to teach you 3 things. Time, place, person. Look your disease for time. In which category your disease is coming. Is your disease showing short-term fluctuation or short-term fluctuation यानी epidemic? तो epidemic है तो कौन सा epidemic है? Is it point source, continuous source or propagated? Or your disease is showing long-term fluctuation or your disease is showing periodic fluctuation. So currently my disease is showing long-term fluctuation, but I taught you short also and periodic also you can understand. So after time, let's come on place. Describe your disease in terms of place. What do you mean by place? Place in a jagah, है ना? So if I'm doing a study, I'm doing a descriptive study, ना, I should define my population before my study, है ना? I should define कि भाई मैं कहाँ कर रही हूँ मेरी study में, what is my population? So my population is Delhi population, Mumbai population, complete India population, a city in a Delhi, a colony in a Delhi. What is my population? I should define it, है ना? I should take a paper. This is my population. This is my hypothesis, and I'm going to test this. I have to write everything and submit it to the committee. So define your population and draw the map of your population. Imagine this is a map of Delhi, India, whatever. Draw your map. Whatever is your population, draw the map. This is map. For example, I'm doing my study on Delhi population. So this is a rough map of Delhi. For example, this is a map of Delhi. Okay. So where are the cases of the lung cancer? So I have to plot in the entire population where are my cases. So I can see there is clustering of cases here. So I have to find the reason why there are more cases of lung cancer here, not anywhere else. There should be a reason behind that. So this is a reason. This is the relevance of the place. The best example here these are known as spot maps. What they are known as? Spot map. In the spot map, draw the map of your population. Your population can be a city, can be a country, can be a colony, can be anything. Draw the map of that and draw dot-like structures of the cases. Where are the cases situated in that map? This is known as spot map, and it will give you clue. For example, this is a map of the London Bridge. This is a map of the London Bridge. You can see this one. Let me tell you exactly. Okay, not London Bridge. It is the Golden Square district of the London. It's a London. In the London, this is an area. You can see this area. You can see this map, this area. This is known as Golden Square district of the London. So John Snow was a scientist. And he has seen that maximum cases are clustered of the cholera is in this region, not anywhere else. Not anywhere else. Maximum clustering of the cholera cases is in this region. You can see the dots. So why? What is the reason? Why cholera is in only this region, not anywhere else in the England? Why? Because he find out there is a common water source. There is a river which is supplying the common water to this area. So it means the infectious organism is coming through the river. So at that time, cholera disease was discovered, but cholera is caused by Vibrio cholerae 50 years after that it was discovered. And this Vibrio cholerae is present in the water. You got my point? So before the discovery of the Vibrio cholerae, 50 years before that, the great scientist, the great epidemiologist, John Snow told us that there is a disease in which diarrhea occurs and the causative agent of that is coming through water. And later on, we found the Vibrio cholerae is present. So this is the relevance of the spot map. If you find the clustering of the cases, you should know the reason why there is a clustering. Say yes. Got it? So if there is a clustering of the cases, you should know the reason why there is a clustering. So in the same way, if your lung cancer clustering is there, so people may be smoking there more. Why people are smoking there more? There may be multiple reasons. So you should find the reason. So this is the relevance of the place. You have to draw the spot map. And finally, person. Whatever is your disease, is it common in some age group? For example, lung cancer. So is it common in children? In the children, you will find no cases of lung cancer, 0 cases. You will find either in young age or middle age, or in old age also, but not in children. So regarding the gender, is it common in males or females? Initially, it was common in males, but nowadays males or females, both they are common. Ethnicity, is it common in married or unmarried? It is common in businessman or serviceman. Is it common in poor people or middle class people or high class people? So based on that, you will get the clues. So describe your disease in terms of time, place, and person. This is descriptive study. We are done with descriptive study. And make up a hypothesis. Formulate a hypothesis. Don't test it, just formulate. Hannah, my disease is lung cancer. So I have described in terms of time, it is showing long-term fluctuation. In terms of place, I have drawn a map and see the clustering of cases. And in terms of person, I have seen it is more common in males. It is not there in children. It is common in youngs. So that is the person distribution. I have seen time, place, person. My descriptive studies are done. And I have formulated a hypothesis. My hypothesis is smoking leads to lung cancer. Now I want to test it. The next study, I want to test it. How many of you got it? We are done with descriptive analysis. I want to teach you 3 studies. Descriptive, analytic, experimental. One by one, we have to do 3 studies. Here we formulate the hypothesis. Here we test the hypothesis. And here after testing, we confirm and publish it finally. Now, after confirming it is no more hypothesis, it will convert into a theorem. It will convert into theory. So in descriptive analysis, we do 3 things to formulate the hypothesis. Describe your disease in terms of time, place, and person. That's it. Describe in terms of time, describe in terms of place, describe in terms of person, and formulate a hypothesis based on that. After that, if you have formulated the hypothesis, go for testing. You can do the testing now. You are ready for the testing, the next study. How many of you got it? Everyone, would you like to give me some answers based on the descriptive study? Then we will start the analytic study. Very difficult to understand the analytic study. So see the descriptive study. See the questions based on that. Give me the answer. All are true for point source epidemic except. Tell me which is not true for point source. जब भी point source आता है तो मुझे तो भोपाल गैस ट्रेजेडी याद आता है. I always remember the same example, Bhopal gas tragedy, and picture become clear in front of me. Epidemic curve rises and falls sharply. Is it true or false? You have to tell me the false. Anna, clustering of cases in a short period of time, that is explosion. Person to person transmission takes place, yes or no? And all the cases develop within one incubation period. What is wrong, people? I'm asking what is wrong. Read the question properly. You people keep on jumping on the answer and give wrong answer always. I'm asking what is wrong. The curve rises rapidly, falls rapidly. This is right, no? I told you the curve is like that, rises rapidly, falls rapidly. So this is right. All the cases are in one incubation period. This is also right, Hannah. And there is explosion in a short period of time. Maximum cases are there. So this is also right. But person to person transmission occurs in propagated one, not here. Here it is not. The gas is coming from the Bhopal gas tragedy. The gas jo inhale kar raha hai usko disease hai, but the one person who have the disease cannot transmit it to the other, hai na? So person to person transmission takes place in propagated one, not here. So incorrect among them is C. How many of you got it? Does anyone having any confusion? C is the correct answer because they are asking the except. The remaining three are right. Got it? The next question. Read thoroughly. Don't rush. Read thoroughly. There is a well which is having contaminated water, resulting in diarrhea in the village. Different people are coming, drinking water, having diarrhea. So what is the example? Is it a common source single exposure or common source continuous exposure? Is it a slow epidemic or propagated epidemic? It is an example of what? I told you it is an example. I told you the prostitute, the well. These are examples of what? Yes, it is an example of continuous exposure. Absolutely right. All are right. Very good. Common source to hai, but exposure is not single. Exposure is continuous. So continuously it's there. The well is there always. Different people are coming, drinking the water, having diarrhea. Different people have diarrhea at different time. It's not like Bhopal gas tragedy. Everyone have the disease at the same time. Here, different people have different same disease but at different time. The time zones, the secondary waves are there. More than one incubation period is there. So correct answer is B, and you all are right. Okay. The same question last year come in the FMG last year. There is a milkman. Instead of well, they have given the milkman, supplying milk in multiple villages. So wherever he is supplying the milk, the person have the disease. So what do you see? It is an example of, again, continuous exposure, common source. Got my point? So milkman is the common, and he is giving the common milk to all of them. But it is the, it is distributing everywhere in different villages. Okay. So correct answer here also it will be like this. So the next question, the graph show uniform curve with no secondary waves. It is correct for which exposure? Multiple exposure, point exposure, sporadic or pandemic. When there is no secondary wave. No secondary wave kis graph mein hota hai? Only one graph have no secondary wave. What is the correct answer, please? What is your correct answer? Yes, it's point epidemic. The Bhopal gas tragedy, the Chernobyl, no secondary waves. We are successfully completed the descriptive study. It was very easy. No formula, nothing. It was descriptive. Description. Descriptive matlab description. Give description in terms of time, place, person. Khatam. Time, place, person. Khatam. Come on, analytic study. Now we have already formulated the hypothesis. Formulation of the hypothesis is already over. Now we have to test the hypothesis. We have to do the testing. Testing is difficult, people. We have to test it, and after testing, confirming is more difficult. First we will test it. Okay. So let's test the hypothesis. So analytic epidemiology is the second step. We all know, it is visible, no need to learn. So first step is descriptive, second step is analytic, and last step, the third step is experimental. In these three steps, we complete a study, and we will come on conclusion whether my hypothesis is right or wrong. If it is wrong, it will be discarded. If it is right, my hypothesis get converted into a theory. Into a theory. Okay. So this is how we conduct a study. It is not the thing that everything we can write, anything we can say, anything. We have to prove. We have to prove. It is an evidence-based medicine. We have to prove everything in this world. Otherwise, no one is going to believe you. If you want to say that smoking leads to lung cancer, prove it. So we have to do in 3 studies. We are done with descriptive. Let's come on analytic study. It is the second. We don't have to formulate. The formulation is already over. Formulation of the hypothesis. We have to test it now. Let's test it. That is the meaning of analysis. Let's test it. Here I am going to teach you 2 studies. case control and cohort. What I'm going to teach you? Two major studies, case control and cohort, one by one. My hypothesis will be same for both of them. Please understand it's difficult. I will say it only once. Case control and cohort study. My hypothesis is same for both of them. By both these study, I will prove the same thing, smoking leads to lung cancer. I know it's prove one, but imagine I'm proving it for first time. First, I will prove it with case control. Then I will prove the same thing with cohort. It's your choice. You can choose any one study. Okay. Both have their advantages and disadvantages that you will understand. Let's start case control study. Okay. Imagine I want to prove that smoking leads to lung cancer. This I want to prove. Okay. So imagine who is my population. I take a population. This is my population. In my population, there are 200 people. Okay, this is my population. Any population I selected. So in the 200 people, there are 100 people having lung cancer. These are my cases. Anna, they have the lung cancer is present in them. And there are 100 people who don't have lung cancer. These are my control. The lung cancer is absent. Maybe some other disease is present in them. They are hypertensive, they have TB, but they don't have lung cancer. So the disease under study present in the persons, they are known as cases, and the disease under study absent in the person, they are known as control. Imagine I'm the investigator. I want to prove smoking leads to lung cancer. What I will do? I'm sitting on a chair. I will call 100 cases, ask them to please stand on my this side, Hannah, and I will call 100 control, and I will ask them to please stand on this side. Hannah, so I'm having 200 people in this room, in this chamber. Imagine. It is not always 200. You can do 2,000 also, 2 lakh also. Bigger is the sample size, better is the study. Just for your understanding, I'm saying 100, 100. It can be 1,000 also, 1 lakh, 1 lakh also. Depends on you. How big conduct you can do the study. Everything requires funding. How much is the fund sanctioned to you? How much you can invest on your study? Okay, so how much government has funded, like given the funds to you? So it all depends on that. Everything requires funding. Nothing is free now. So you call 100 people, 100 people, everything requires funding. Anna. So 100 cases are there, 100 control. These are the people, they already have lung cancer and they are very sad and they are very, depressed, and they have the disease. These are the control. They don't have lung cancer. Anna, they are healthy people. I mean, they can have some other disease, but not lung cancer. So I will call them control. Okay, what I will do, I'm the investigator. I want to prove that smoking leads to lung cancer. One by one, I start calling the cases to me, Hannah, in my chamber. This is my chamber. One by one, in personnel, I will call them. I will ask them only one question. Do you smoke? Yes or no? If you smoke, since how many years you smoke? In the last 10 years, have you smoked? How many? Did you smoke BD, cigarette? Hannah, what do you, cigar? What do you smoke exactly, and how many packets? How many packets in one day? So that is the history I will take. That is, I will take the history of exposure. That's it. And let them go. Hannah. So one by one, they will call and they will say yes, no, yes, no, yes, no, I will take. And one by one, I will call them also and I will ask the same question. So at the end, here also the two groups are there. Some say yes, exposure is present. Some say exposure is not there. Here also I'm having the two groups. Some say exposure is present. Some say exposure is not there. Imagine here, they will say exposure is present. They say yes, 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 ma'am, we smoke in the past and that's why we have lung cancer. Kash nahi kiya hota us samay, but now already the disease is there. Hai These are the person, they will double unlucky. They say we don't smoke, we have not touched the smoke, still we have the lung cancer. See the tragedy. Hai These are the people, they smoke, they are very happy. See, we smoke, we don't have lung cancer, but in future they can have. Currently they don't have. And these are the people very Siddha Sada. They said we don't smoke and we don't have lung cancer also. So we are the four categories. You can imagine the mentality of all four. Hana? These are the four type of people. So here 100 divided in two group, here 100 divided in two group. Hana? So just I will take the exposure history in one day only, in 2 days. Karna kya hai? I will call them one by one, take a history and let them go. My study is over. So I can complete the case control study in 1 day also. Why it is called as case control? 100 cases, 100 control. That's why case control study. Anna. So what I will do, I will make a table. For example, I am conducting my study in 2023. Currently is 2023, no? 23. So I'm conducting my study in 2023. So I'm having 100 cases, 100 control. Here disease present, here disease absent. These are my cases, these are my control. So I will take the history, I will take the history. Here maybe out of 100, 70 are smoker, 30 are non-smoker. Here out of 100, maybe 10 are smoker, 90 are not. Any figure you can get. So you get four category, A, C, B, D. Divide them in 4 categories. This is AC, this is BD. Got it? We will make the 2 by 2 table. Don't worry. So I'm asking till last 10, 20 years, have you smoked or not? So it is based on the memory of the people. Hannah, people can lie to you. Hannah, you are not going and checking. Maybe some smoker is saying, no, ma'am, I don't smoke. So I have to rely. I don't have any method to check and go in the past and check whether the person is saying yes or no, right or wrong. So memory bias is always there. It is a bias. It's a type of bias we say. So memory bias is always a problem here. It is based on recall. It is based on recall of the people. You have to trust the people. What they are saying, you will say, yes, it's right. There is no way to check it. So this is a disadvantage of this study. But advantage, it's very fast. In one day I can conduct. It's very cheap. Nothing is required. Call cases, call control, take history on a paper pen or on a computer. You just enter it. That's it. It's very cheap. Nothing much resources are not required. So it's cheap, it's fast, it's rapid, but it have a memory recall. है ना? Memory recall bias. People sometimes lie. They say, I don't remember. So what do? No, they have a recall problem. They have a recall problem. They have a memory problem. They can lie. So this is a disadvantage of the study. And one more thing, where the study is going, you can see the study is going from present to past. You are conducting the study right now, but you are asking regarding the past. So see the arrow, from present to past you are going. So this is known as retrospective study. Retrospective, we are going in the past. So case control study is retrospective. Say yes. Have you understood retrospective meaning? So we are conducting a case control study which is retrospective. We are going from present to past. We are going from effect to cause. First we have pakda humne kya? Effect. The lung cancer is already there. And now we are going towards the cause, whether cause is there or not. So this is known as effect to cause study. This is known as retrospective study. This is present to past study. And the good thing is that it's cheap, it's rapid, it's fast. The bad thing is that the memory and recall bias is there. People can lie. People don't recall. Say people react. This is case control study. Make a table like this. Make a table like this. So see, this is my study. Everyone on the screen. So this is my case control study. Everyone on the screen. Listen, this is my total population. I decide my population. Maybe Delhi, Mumbai, Indore, whatever is your population. Maybe complete India. Out of the population, I'm having 100 cases, 100 controls. Okay, I'm having 100 cases with me standing on my this side. I'm having 100 controls standing on my this side. One by one, I will call and take a history. You smoke, you don't smoke. You smoke, you don't smoke. So here also I divided the people into two categories. Exposed, non-exposed, means they smoke, they don't smoke. And here also I divide them into two categories. They smoke, they don't smoke. Got it? So this is the study I have done in one day. So make a 2x2 table. Yesterday I taught you 2x2 table to how to make in screening of disease. How many of you were present yesterday? I told you always take disease at the top. Always disease at the top. It's a rule. Disease present, disease absent. And always take exposure or risk factor at the left hand corner. Exposure present, exposure absent. Say yes. Got it? Hannah? So write down A, B, C, D. What is A? What is A? Who is A? A is the person, they smoke and they have the lung cancer. Imagine a person who smoked since 10 years, 20 years, and now the person have lung cancer. The person have the regret that why I have smoked and now I have the disease. Okay, that is the A. Both the things are positive. See the D. Both things are negative. They don't smoke. They don't have lung cancer. They're very happy. No, we don't smoke. We are Sida, Sada, simple people. We don't smoke. Okay, and we don't have lung cancer. Okay, so A and D are straightforward. There is no problem in that. But there is a problem in B and C always. So let's say B. Who are B? Who are B? They smoke, but they don't have lung cancer. They will be like very proudy. Ma'am, we smoke, but we don't have lung cancer. Kuch nahi hota hai smoking se. They will be like that. We smoke, but we don't have lung cancer. But in future, you never know they can have. Okay, but currently they don't have. Okay, leave it. And what about C? They are the most unluckiest one. They don't smoke. Still, they have the lung cancer. They will say, ma'am, we have not even touched the smoking. We have not seen the packet of smoke. Still, we have the lung cancer. Okay, so you can see, you can understand all four. A, B, C, D. Got it? Say yes, react. Okay, so this is the study. Okay, this is the case control. Now, what do you will do the analysis. So we have already finished the study. Imagine 100 cases, 100 control. 100 cases divided into A and C. 100 control divided into B and D. I have made this table in front of me. I've let them go. You just go, the study is over. Now I will do the calculations. In calculation, I will calculate two things. Exposure rate and odd ratio. Exposure rate, I will calculate two exposure rate. Exposure rate in cases and exposure rate in control. You tell me, what is exposure rate in cases? Who are the total cases? Who are the total cases? Who are cases? The disease is present. A plus C is the total case. A plus C. Out of A plus C, how many? How many of them smoke? How many of them smoke? So A smoke. Out of A plus C, A smoke. So A upon A plus C is the exposure rate in cases. In cases, what is the exposure? What are control? You will see, ma'am, the disease is absent in them. That is B plus D. So B plus D is the control. Out of B plus D, how many smoke? That is B. So B upon B plus D is the exposure rate in control. How many of you got it? How many of you got it? So if the answer of this is greater than this, it means there is an association. I'm not saying by chance. No, my hypothesis is smoking leads to lung cancer. You will say, ma'am, this is your hypothesis. Maybe you are right, maybe you are wrong. So maybe by chance you feel, by chance, is opposite of statically proven. I do not want this by chance. It is not by chance. It is actually association. Association and by chance are two opposite things. I want to prove it's association. It's a real association. It's not by chance. Hana, I want to prove that. Hana. So it will be proven if the answer of this is greater than this. Let me show you a figure. I've told you the meaning of this. Listen, let me erase. You do the calculations, please. Just a second. I have to erase it. I want to erase it. I mean, give me a minute. Can you calculate? Can you make a 2 by 2 table and do the calculations and exposure rate in cases and control? Can you please do so? I have written the values of ABCD in front of you. I have written the values of ABCD in front of you. You can see what is A, what is B, what is C, what is D in the table. Hana? So what is the formula of exposure rate in cases? Exposure rate in cases. What is the formula I told you? Huh? A upon A plus C. Do the calculation. A is 70 upon 100. So here 70 upon 70 plus 30. That is 100. And what is the exposure rate in controls? What formula I told you? What is the formula I told you? So here I told you B upon B plus D. Okay. So it's 10 upon 10 plus 90. So it's 10 upon 100. Here 70%, here 10%. Of course. So it is much more than this. So the people who smoke, उनमें से 70 लोगों को cancer हुआ. The people who don't smoke, उनमें से 10 को हुआ. That is the meaning in Hindi. है ना? So it is not by chance. There is a real association. You have to calculate the exposure rate. Exposure rates are calculated. How many of you got it? This is how we calculate the exposure rate. Right? Chalo, I agree that smoking leads to lung cancer. But how strong? Tell me the strength of association. I agree the exposure, they are associated. They are associated because exposure rate in cases is more than exposure rate in control. The one who smoke, they have more cancer. The one who don't smoke, they have less cancer. So I have seen association is there. It's not by chance. But what is the strength of association? To calculate the strength of association, we calculate odd ratio. What is the odd ratio? It's cross product. Cross product. You know, cross product. Can you see this is cross product? So it's AD upon BC. It's AD upon BC. Learn the formula. It's AD upon BC. Calculate AD upon BC. Hana? So there are three possibilities. If you calculate AD upon BC, this is odd ratio. Odd ratio is AD upon BC. There are three possibilities. Either the odd ratio is less than 1 or it's equal to 1. Both are equal. They will cancel out. It's 1. Or odd ratio is greater than 1. Or kya hua? One of the three possibilities. If it is more than 1, there is a positive association between the two. So smoking, just suppose the answer is more than 1, it's 2, it's 3, it's 4, jo bhi answer hai. So smoking increases the chances of lung cancer that times. Smoking increases the chances of lung cancer 2 times, 3 times, 4 times. There is a positive association. Equal to 1 means smoking and lung cancer are two different entities. They are not related to each other. Don't please correlate them. There is no association. And less than 1 means there is a negative association. Smoking protects lung cancer. How good it was. Now, if it was true, I also smoke. And I don't smoke. I also start smoking if it was true. That if odd ratio is less than 1 means smoking protects lung cancer. That it is a hypothesis. Listen, anything can happen. We are doing a study. We are going to prove something. So whatever you are proving, maybe that is true. Maybe the two things are not related to each other, or by chance aapko aisa lag gaya, hai na? Or maybe whatever you think opposite of that is true. Opposite of that may also be true. Hai na? I think smoking leads to lung cancer, but the truth is that smoking protects lung cancer. That can also, although it's not there, 101 studies are done. Every time odd ratio is more than 1. Every time. So don't start smoking. Hai na? So I'm just saying it can also happen. So here negative association is also there. So based on the odd ratio, we decide the strength of the association. Positive association, no association, negative. Negative means protective. How many of you got it? We are done with case control study. Huh? We are done with case control study. Let me do a cohort study also, then I will summarize. Okay. Can I start cohort study? We are done with case control. Respond. Can I start cohort study? The second study, cohort study. Okay. After that, we will take a break. Okay. So let's start cohort study. The second study is the cohort study. What we will do, see, this is the plan. This is the plan here. Can you see? This is my population. Now see what I am going to do here. This is my population. Anna, what I have done there in case control? I have called 100 cases, 100 control. 100 patient of lung cancer standing on this side and 100 patients, 100 healthy people who don't have lung cancer standing on this side. I have done that. Anna, I started my study with lung cancer and then I asked about the exposure. Do you smoke? Do you smoke? Do you smoke? Like that. Here I do the opposite. I start my study with the exposure. So I will call 100 smoker, 100 non-smoker. It's very easy to find the smoker, ask them to stand on this side. And it's very difficult to find non-smoker nowadays who don't smoke at all and ask them to stand on this side. So I'm having 100 smokers with me. I will call them exposed. and I'm having 100 non-smokers with me. 100 is just a number to explain. It can be 1,000, it can be anything. So I'm having 100 exposed, 100 non-exposed. What I will do? I will not take any history. They are smoking. I will say, okay, you smoke, you keep on smoking. I will not hinder. You don't smoke, okay, you don't smoke. I will not hinder. I will not give my personal advice to anyone because it is an observational study. You don't have to experiment. You don't have to hinder. You don't have to interfere. I mean, whatever is happening, keep the flow. Just observe. You just keep the flow. Do you smoke? Ask them, okay, you continue smoking. If you smoke, it's okay, you smoke. You don't smoke, okay, you don't smoke. Okay, so that's it. You what do? Just call them one by one, take their address, email ID, take their phone number, mobile number, landline number, all the ways to contact them, alternate address, current address, all the ways to contact them and ask them to go. Okay, go back. It's okay. The study is not done. Study will continue, but you people go. Now every week, once a week or once a month, call them. Cancer hua kya? Do you have cancer? Do you have cancer? Do you have cancer? Keep tracing them. So keep tracing them for the next 10 years. Minimum 10 years, 20 years, you keep tracing them. People will get frustrated every time mom call and ask, do you have cancer? They will block you and they will not talk to you. They will cut your call. That can happen. So here you have to do the follow-up. Follow-up requires money. You have to follow up. Here, not only 200 people I'm following, maybe in lakhs I'm following. So if they are not responding, you have to visit their place. Send someone to visit their place, to visit their address. You have to keep a close follow-up. They can change their house. You can lose them in the follow-up. So you have to keep a close follow-up. You email them. Try not to like doing a spam, but once a month or once a week, you can ask them. Okay, so out of them, after 10 years, from the smokers, some will have cancer, some don't have cancer. And out of the non-smoker also, after 10 years, some will have cancer, some will not have cancer. So again, I divided them in 4 groups. So this study is cohort study. I'm going from present to future. That's why it's a prospective study. There I was going from present to past. Here I'm going in future. The last study required 1 day. This study required 10 years. It's time consuming. Cohort is time consuming, and cohort is costly also, because for follow-up, for emailing, for calling, you require money. For follow-up, you visit the place personally, so you require money. That was cheap, this is costly. That was rapid, this is slow. But this is much better. This is better. The results are more reliable here. Their recall bias is not there. You don't have to ask and rely on the statement of the people. There we have to ask, do you smoke, do you don't smoke? Whatever they are saying, we have to trust them. There is no other way. Sometimes they say, ma'am, I don't remember. So we have to trust. We cannot insist. Okay, whatever they are saying. So recall bias was a problem. Memory bias was a problem here. Here there is no problem. You will see with your eyes ki kisko cancer hua, kisko nahi hua. You visit and see kisko hua, kisko nahi hua. You don't have to trust them. You will follow by your own. Okay, so recall bias is not a problem here. Got it? Say yes. So this is cohort, and we are going from present to future. That's why it is known as prospective study. What is known as prospective? That was retrospective. This one is prospective. How many of you got it? So what we are doing, we are starting our study in 2022. With 100 smoker, 100 non-smoker. These are exposed, these are non-exposed. And we are doing follow-up for next 10 years. In 2030 or 2040, we are seeing how many have cancer, not cancer, cancer, not cancer. Here also, we will make the 2x2 table like that only. The same 2x2. Disease present, absent, exposure present, absent. Table will not change. Table is same for both of them. How many of you got it? So this study is prospective. Case control was retrospective. This one is prospective. Okay, that was effect to cause. This one is cause to effect. You are starting with smoking. Smoking is a cause, and you are going towards effect. So this study is known as cause to effect, and that was effect to cause. This is prospective. That was retrospective. And you understand the pros and cons of both of them. I mean, advantage, disadvantage of both of them. Got it? So there we have calculated exposure rate. If you remember, here we will calculate, just a second. Here we will calculate the incidence rate. Calculate the incidence rate in the smoker and non-smoker. Who are smoker? Who all are smoker? You will say, smoker are there who smoke in which the exposure is present. These all are smokers. You can see exposure is present. A plus B. Out of them, who have the disease? A. So A upon A plus B. And non-exposure, I mean incidence rate among non-smoker. So C plus D. Among them, C have the disease. So C upon C plus D. So if the answer of this is greater than this, so the association is not by chance, there is a real association. And there we calculate odd ratio. Here we calculate relative risk. वहां पे odd ratio था, यहाँ पे उसका corresponding relative risk है. वहां पे exposure rate था, यहाँ पे incidence rate. Got it? You should know what is ABCD. I will summarize in the end. I'm comparing the two studies back to back. So what is relative risk? वहां पे odd ratio का formula क्या था? AD upon BC. Here the ratio of incidence of exposed upon non-exposed. That is A upon A plus B whole upon C plus D. That is the ratio of these two. This upon this. This is relative risk. Again, we are having the same. So this is the formula. You can see. A upon A plus D whole upon C plus D. This is relative risk. Again, the three possibilities. Equal to 1, more than 1, less than 1. The same three possibilities. How many of you got it? We are done. How many of you got it? Shall I summarize? Shall I summarize? We will do some numericals also. Shall I summarize the two studies? Shall I summarize? I'm teaching you two studies. Case control and cohort. Okay. So you know the design. You want me to draw the design again? Okay. Let me draw. So here we start with the population. This is my population. In case control, we start with the population. This is my population. From the population, I will call 100 cases and 100 control. Okay. And I will take them the history. It is based on history. I'm taking history in one day only. I'm calling them one by one, and asking them who smoke, who don't smoke, who smoke, who don't smoke. So I will divide them A, C, B, D into 4 groups. That's it. Study is done in one day. Here, I'm starting with, again, population, but I'm starting with 100 smoker and 100 non-smoker. See the starting point. See the starting point here and see the starting point here. Okay. And here I'm doing the follow-up. I'm not doing the history. It is based on follow-up. Here I said history. Here I said follow-up. You have to do the follow-up for next 10 years, next 20 years. After that, we divide them into 4 categories. They have cancer, they don't have, they have there. So A, B, C, D, like that. How many of you got it? So you can see here, we are going from present to past. That's why retrospective. Here we are going from present to future. That's why prospective. Okay. Here we are going from effect to cause. Effect is disease. Here we are going from cause towards effect. And now first smoking we are starting and then looking for lung cancer. Here we started with lung cancer and asking for smoking. That is the meaning. Okay. Okay. So I told you the advantages here. This one is cheap, but here it is costly because follow-up is costly. No, this is done in one day. This is done in 10 years. Okay. This is rapid, fast, and this is time consuming. Time consuming. But there is a problem here, the memory bias. Memory bias or recall bias is a problem here, which is not a problem here. Say yes, got it. So you have to understand this. This is the main agenda. Now I will draw a 2 by 2 table and explain you the analytics of both of them. Let me draw a 2 by 2 table. You will help me for the 2 by 2 table. This 2 by 2 table you have to learn. Bina uske PSM nahi hota. Okay, this is my 2 by 2 table. Here I will write disease at the top and exposure and the left hand corner. So disease present absent, exposure present absent. Okay, so you have to say A, B, C, D. Always write that. I explained you what is A, B, C, D. In A, both are positive, in D, both are negative. You can understand. Okay, Ji. Now let me continue my studies. So with this table, I will tell you what will happen in case control. And with this table only, I will tell you what you have to calculate in cohort. Anna? Okay. So here we have to calculate the exposure rate. Exposure rate in cases and exposure rate in control. Anna? So just learn the formula. And here we have to calculate incidence rate. Incidence rate in smoker and non-smoker. I mean exposed person and non-exposed person. Incidence rate. Here we calculate exposure rate. Here we calculate incidence rate. Anna? So see the formula. I'm writing the 4 formulas in front of you. Right? The numerator is always A and here the numerator is A. Just a second. Exposure and C. A and C. Here upon me A plus C and the one who are exposed. Exposure rate in cases. Here B, I'm sorry. It's B upon B plus D. B upon B plus D. Got it? A upon A plus C, B upon B plus D is the formula. And here, Hannah, you can see A upon A plus C and B upon B plus D. This is the formula. And here in cohort study, you will say A upon A plus B. Okay? And C upon C plus D. So numerator is always AC, AC. There is no problem in that, but the denominator is changing. So if the value of this is greater than this, and here the value of this is greater than this, it will be proven there is an association. If you don't want to learn, it's okay. Nobody is going to ask the questions on that. Main questions will come on the second thing, which I'm going to teach you now. You have to calculate odd ratio here. And you have to calculate relative risk here. Questions come on that. Hannah, learn the formula of odd ratio. It's cross product, AD upon BC. Here it's AD upon BC, as simple as that. And this one you have to divide the two. A upon A plus B whole upon C plus D. Okay, so you have to calculate. So this is the summary. How many of you got it? How many of you have trouble in that? So please compare the odd ratio and relative risk of both of them. Now for both of them, odd ratio or relative risk. We calculate odd ratio in case control. We calculate relative risk in cohort. In both of them, we have three options. Either they are equal to 1, or they are less than 1, or they are greater than 1. Both odd ratio as well as relative risk. Here also, relative risk is same as that of odd ratio. It's corresponding. So what do you mean by that? What do you mean by that? If it is equal to 1, there is no association. Both are different entities. If it is more than 1, there is a positive association. Smoking leads to lung cancer. And if it is a less than 1, there is a negative association. Smoking is protective in lung cancer. That can also be proved. So based on that, you will confirm test your hypothesis, not confirm. And my hypothesis is tested. Whatever is the result, my hypothesis is tested. How many of you got it? Please. So that is a thing we have seen. How many of you got it? Say something. We will solve some numericals. Say something. We will solve some numericals after that. We will take some numericals and solve it correctly. With both the studies, I will teach you how to calculate that. Okay. Say, got it? So this is the 2 studies we have completed. They are in front of you, case control and cohort. Everyone, does anyone have any doubt? This is the pros and cons of each study. We will study them, and we will see some numericals based on that. Anyone having any trouble? We are done with descriptive study. We are done with analytic. Analytic mein numericals karaungi abhi. And finally, we will complete the experimental. So epidemiology will be over. And we have to see the vaccines then. Okay, ji. So let's take a break. Ek break le lete hain, hai na? So I would like to take a bigger break. And after that, there will be no break. This is final break, the lunch break, whatever break you say. After that, I will not take any break. So how much time? It's 12:20. It's 12:25. Hai na? 12:23 at my clock. So can I start at 2 directly, 2 to 6 non-stop with a little 15-minute coffee break in between? The 4 hours more. We will first finish the epidemiology, followed by I will start the preventive obstetrics and this, and then demography. Okay, ji. 6, or we can extend it till 6:30 also. Okay, ji. So let's meet at 2. Let's meet at 2. I will be back. I'm ending this link. You will get another link at 1:45. Okay? So please join with another link. Bye-bye. Okay? So please come on time. We will continue with the experimental study directly. Okay? We will see some numericals of this, and then we will start the experimental study. Finish this as soon as possible and come on. This is the biggest topic in entire PSM. Anna, you will be saying, ma'am, only 3 or 4 systems. Baki is a very small. You know, waste management hardly required 20 minutes. Disaster management, 20 minutes. Mental health, 20 minutes. International health, 10 minutes. So I will complete all these very rapidly. But these are the big chunks you have to understand. There is conceptual things in that. So first, finish the big chunk. And then tomorrow onwards, tomorrow and a day after tomorrow, we will finish the small stuff. Okay? Okay. So let's meet at 2 sharp. Have your lunch. And after lunch, have a cup of tea, coffee before coming in my class. Okay? Bye-bye. I'm ending it.